Unified School District Board of Education on June 30th at 4:30. Please rise and join me in the Pledge of Allegiance. Place your right hand over your heart and repeat with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, let the roll call reflect that everyone is present either in person or on video conference or some other means of electronics. So, is there a motion to approve the agenda?
So moved.
By Mr. Tomac. Is there a second?
Second, Linda Porras.
Second by Linda Porras. All those in favor say aye. Aye.
Aye.
All those opposed? That carries 5-0. Public comment on open session items. Mr. Tomac.
We have one public comment here and a number that will be read here shortly by people who emailed them in. So it's Trina Gonzalez-Alissi, President DSTA. You're up.
Good afternoon, members of Cabinet and School Board. There are many factors to take into consideration when deciding what school will look like for Desert Sands in August. DSTA does not envy the responsibility you are facing to try to please everyone. Let me share with you the concerns that the union has when looking out for the health and safety of its certificated workforce and those we serve when considering any version of in-person teaching and learning models. Obvious adherence to health guidelines. This would include all COVID guidelines from the CDC, the CDE, the CDPH, Cal OSHA, and any other alphabet you can think of. Physical distancing. How will this be enforced among students in the classroom, at lunch, during unstructured time like passing periods and recess? Even at half the occupancy we would normally have, we would not be able to successfully implement 6 feet of distance in the majority of the classrooms in Desert Sands. Personal protective equipment. We will need to be assured of adequate personal protective equipment for staff as well as students. This includes items such as face coverings or masks, face shields with drapes, access to soap and water, hand sanitizer, gloves, etc. Daily disinfecting and sanitization of work areas. We need assurance that this will be done with the utmost attention to detail every day. HVAC concerns. The CDC recommends that ventilation systems operate at a level that is not the current standard in Desert Sands. Those systems will need to be adjusted to provide the highest level of quality and care for staff and students. Health screening, testing, notification, and contact tracing. What are the protocols we will implement to ensure the health and safety of all stakeholders? What will the protocols be for when a staff member or student reports that they have tested positive for COVID-19? Does every member of the class have to quarantine for 14 days? What about the front office staff or nutrition services? Does the whole work site go into self-quarantine for 14 days? At-risk employees. We need to start developing plans right away for how to accommodate individuals with underlying health issues who would be putting their health at great risk with a return to the worksite model. Again, we recognize that there are an enormous amount of factors to consider. Please let us work together and collaborate to reach a solution that takes the health and safety of the workforce, as well as those we serve, into consideration before any other concerns. Thank you.
Continued public comment. Mr. Tomac will be reading the public comments that were sent in that wanted to be read aloud. So, Mr. Tomac.
Thank you very much. The first one is from Michelle Van Halen. California's death toll yesterday is 5,934. Every day the infection rate and death rate is increasing. Please allow us to teach 100% online.
Point of order. Excuse me, I'm sorry for interrupting, but we can't hear you. Do you have a microphone?
What's that?
We can't hear you. Do you have a microphone?
I have to wear a mask. It's kind of tough, and I'll do my best.
But you have a microphone.
I understand. Thank you. Please allow us to teach 100% online. Dr. Fauci states yesterday that they will have a vaccine by December, January, February. Once we're all vaccinated, we can all go back in person. No more deaths, please. The second one is from Amanda Anderson. There has been a lot of discussion about student safety, which is important. But I would like to ask how the district intends to protect its teachers and other staff at school sites. What accommodations will be made available for teachers who are at high risk due to underlying medical conditions or live in households with others who are at high risk? We cannot manage the safety practices of the 30+ households we will interact with if schools reopen. Also, how will you ensure that workloads are equitable for teachers if there are multiple models of implementation? Creating and curating effective distance learning materials requires an incredible amount of time. What district level and curation of materials will be available to assist teachers should this be the model that we start with? Greg Tyler. I would like to say, as a science teacher at Palm Desert High School, it is extremely critical that our students have a large portion of face-to-face interactive time so that they can apply the skills necessary to progress and enter the university system. Distance learning has its uses. Voters inadequate to address the needs of high school students here at Palm Desert High School. Our students need and want that personal time to ask questions immediately when we are presenting information, and I think it's really critical that we have that available to them. I do not understand some parents and students might feel it is too much of a risk to come back, so we should allow some type of alternative instruction, perhaps offered through one of the alternate campuses. Heather Solis. I am in a portable classroom with no running water. I am unable to teach and watch that my students wash their hands properly. When asked to get hand sanitizer when this is first started, the answer from the district and school was no. I begged parents and I had to pay an outrageous amount for a bottle. If I had yard duty at first recess, I was unable to wash my hands for over 4 hours. This is unacceptable. Things that were promised to be fixed on our construction areas took months, and many things that were promised that were not addressed until I sent multiple emails, including bathroom sanitation, privacy, water, and pressure issues. I'm extremely concerned with the safety of myself and my students when there is so much that is not taken seriously before we shut down the schools. Robert Arias. Suggestion: half-day class with remote continuance of assignments with 8 to 10 students per session, morning and afternoon. Allowing for 1 hour overlap between sessions for lunch periods, prep periods. By increasing the school day with 90 more minutes, the district could move towards a 4-day school week that could be maintained year-round. Since we already have 5 to 7 Mondays that are considered holidays, then the 4-day school week could be Tuesday through Friday. Julia Alberg Burbank. As an 18-year employee, my well-being and physical safety has never felt less a concern to our elected officials than it does currently. I most want to return to the school site, but will be unable to unless mask wearing is required and enforced. It would be unjust for the elected officials of the school board to deny me my livelihood by not insisting that adults stay masked while anywhere on campus. I am aware of peers that have gone out and about without precautions, as well as school board members, and I need to be protected at work in order to minimize my risk and do my job. Bottom line, every adult should be wearing a mask all the time. Eugene Ramos. Unless we go 100% online, we will have students in physical education classes. These classes tend to be double in size, if not larger than those of traditional classrooms. My question is, will we still maintain this ratio of being larger in size, and will secondary students be expected to change for class activities as has traditionally been the case? Deanna Martin. There are so many questions swirling around school opening in the wake of COVID-19 global pandemic, with the common question being, what will it look like in August? It seems that the appropriate steps would be to include options of virtual learning only, a combination of virtual learning and traditional but traditional only with social distancing and masks and precautionary rules and procedures present. Without adequate PPE and precautionary safeguards and procedures such as social distancing, masks, and cleaning procedures, all students and staff are at risk in a traditional setting. This is a global pandemic and is escalating, so it cannot be business as usual in any kind of traditional setting. Besides, the questions and concerns that we have on so many topics, such as rules for staff and students and how they will be enforced, a pertinent question concerns what provisions and procedures will be in place for at-risk students and staff. Also, what will the procedures be if a staff member or student on a campus has contracted COVID-19? Please work on these two questions during your study session. Thank you. Teresa Amadei. As a committed public school teacher in DSUSD, of course I want to get back to class. I would urge the school board to consider an all online option unless there is a vaccine or successful treatment of the coronavirus that does not require hospitalization or a ventilator. I've had the opportunity to teach online summer school this year. I was assigned to teach Math 1 first semester, and I am currently teaching English 1 for a second semester. So far, my teaching experience during summer school has been nothing short of miraculous. For example, last week I was teaching a live math lesson while I had students physically in Mexico, Oceanside, Georgia, 5 hours north of La Quinta, and in line waiting for a COVID-19 test. Think about that. In a traditional setting, all these students would have been absent from summer school. They would have no choice, life over learning. In a traditional model, missing that day of instruction would result in a significant learning gap. With our distance delivery digital option, they didn't have to. They were able to be where they needed to be and still have access to the math content that day. The students were able to learn and live. That is meeting them where they are, that is teaching and respecting the whole child. I'm concerned that the public will put pressure on DSUSD to return to business as usual. Offering in-person education meets a lot of demands for our families. I get it, but that model will not offer the safety we need to assure each student and staff member are at the lowest possible risk for contracting the virus. Can you imagine the liability if we became ground zero for a new virus epicenter in the valley? Our rooms are great spaces, but they cannot possibly accommodate the 6 square feet needed per person with a typical roster of 38 to 41 students. Even if we did shifts or installed plexiglass or thought that 100% of adolescents would follow our safety precautions and directives, it would take only one breach to put everyone at risk to contract a deadly disease that currently has no cure. Please continue a robust distance delivery model until you can assure every employee, every student, and every community member is safe while at Desert Sands. Laura Anesco. Desert Sands should consider giving a 2-year incentive to older teachers who are in harm's way since they are in a higher health risk category. We have been dedicated, hardworking teachers for Desert Sands with legitimate stress and fears. We are stressed with adjusting and trying to navigate our way around online learning, plus the added fears of going back to the classroom. Our main fear in the classroom is that safety and health requirements will not be implemented effectively which puts lives in danger, which our lives in danger. As hardworking, caring teachers of 25+ years, we are asking the district to consider giving the 2-year incentive plan to us. It would not only be beneficial to the district, but the right thing to do for our dedicated years of service. Rick Miller. It is a given that students, school site staffs, parents, and district personnel would all like to see our school campuses fully open in August. However, given the reality of the pandemic, that does not seem probable yet. A plan to have at least teachers and staff begin the year at their sites would allow for access to technology and instructional materials, phones, the ability to collaborate, and a direct connection to the community. This could be done safely with distancing and masks. Then, when and under whatever circumstances students can safely return, it would be a smoother transition. Janine Nielsen. I received the staff survey and responded to start with a traditional year. However, now that the cases has spiked due to opening businesses, I have changed my mind. I believe that we should do 100% virtual for the first trimester. It would include using email communication with parents and posting info on our school websites. Parents could receive email instructions on getting their children online for Google Classroom, Class Dojo, etc. Kids can access resources through Clever, or Clever, I guess it is. It is not the best way to start a school year, but trying to enforce kids to comply with wearing masks, cleaning all the time, PPE for staff would be nearly impossible. Parents can get help from staff to get all these online resources established. It would be easier to manage and reduce costs due to PPE, cleaning, and absenteeism affecting their budget. J.C. Alexander. First, I want to applaud Desert Sands in giving a voice to everyone in our community. My voice comes with 24 years experience as a first grade teacher, a mother of 3, and myself, a product of Desert Sands schools. As many have said before me, my #1 wish is to go back to school and welcome my first graders, meet their families, and soon begin our journey of learning. I thought possibly we could go back via a hybrid system, less students, more precautionary safety measures, etc. However, as of today, it's been abundantly clear that we simply cannot. There are so many variables to physically attending schools that we cannot control the school environment as much as we try. We spend a lot of extra money, which we do not have, to create a sterile environment, and then it will inevitably happen. We will have our first COVID case and school will then be forced to shut down. We are back to square one. A lot of time, money, and effort will have gone to creating that glorious first day of school. I really prefer to be at school with my students. However, it simply won't work at this time. We should not get everyone's hopes up and put multiple people at risk of infection just to say we physically open school. As of today, COVID-19 is far from flatlining. In fact, infection rates are rising over 30 states, including our own. Our country does not have a common model to try and combat this virus. Things are not going well. Theme parks are closed, concerts are all postponed until next year, and Broadway announced they will remain closed until next year. Using our common sense, we should begin our school year distance learning. Until health experts say it is safe for large groups to congregate, we should heed their guidelines. We cannot rush into distance learning. Teachers will need time to collaborate with their grade levels and create amazing learning that will engage our students and move them forward. We all need to be responsible and present. We can do this. Just trust your educators to educate, give us the training and continued support, and I believe we can all find success. Frederick Muehlman. Dear school board members and guests, as I would like to respect everyone's time, I will jump in. It is my opinion that we cannot safely reopen our schools in any manner to on-site education, at least during the fall. Instead, we should offer virtual learning as we greet our students this August. The number of cases in our area are climbing rapidly. As of June 29th, Riverside reported 991 new cases of COVID-19 over the weekend and 2 new confirmed deaths. Riverside County has doubled COVID-19 cases since June 1st, and the county supervisors have ordered bars to close again. With a staggering increase in cases, it makes no sense to put our teachers, staff, students, and parents in unnecessary danger. We now know that all ages can be impacted, and the CDC has revoked the earlier guidance about those at younger ages being less impacted. As an educator, virtual learning is by no stretch of the imagination my preferred outcome. I miss my students and colleagues and the bonds we form over time. I miss the laughter and the fun lessons that simply cannot be replaced via Zoom. However, in this pandemic, we should be putting health first, and face-to-face education is too risky right now. In my conversation with approximately half the educators at my site, I have encountered no one that wants to return to school. This includes educators with new babies, educators with school-age children, those caring for elderly parents, those with higher risk factors, as well as those who are simply afraid of being asymptomatic spreaders of COVID-19. I understand that this is a difficult decision, that virtual learning is perhaps the least popular option for many, but it's a necessity. Perhaps an agreement could be reached to allow for increased technology trainings and a time for staff to create site-specific distance learning plans. If we can flatten the curve now, perhaps a viable treatment or vaccine will be available later in the school year that can allow us all to return to the classroom where we all desperately need to be. Thank you for your time.
Point of order. I'm sorry to interrupt again, but I'm getting texts from people who are saying that they cannot hear you. So if you could move the microphone closer to your mouth.
I am very close to the mic as I can be, but I will do my best. Thank you.
People can't hear your comments, Mr. Tomac.
I understand. Name is Amadei. Read aloud. I feel that reopening school is not an option at this point. You would purposely be putting my daughter in harm's way and exposing her and all the other children and staff to this virus. That is a scary thing. One asymptomatic person and all the staff and students go home to possibly infect everyone in that household. As adults responsible for the safety of others, I think it is irresponsible to put our kids and your employees in harm's way. The numbers show that our curve and risk of exposure is going up at this time. We are setting records across the nation for infections. If you decide to open schools, you'll be contributing to our 3 hospitals being bombarded. Our desert can't support the increase in cases. Your number one priority should always be the safety of our children. Unless there is a vaccine for coronavirus, schools should be online only. On March 15th, Riverside County had 57 COVID cases and 0 deaths. That was enough to warrant school closure. As of June 27th, Riverside County has 4,810 cases and 33 deaths. Does it seem more or less likely that opening schools would be dangerous for our students? Melinda Larson. I'm in favor of doing anything we can to get my students, which include my high school age daughter, and me physically back in the school in the fall. Distance learning, even with good technology and dedicated teachers, comes nowhere near the quality of face-to-face instruction. Our students have already lost a huge chunk of their education last year. I can't imagine where they'll be after more distance learning. I think we should come up with a couple of different models and see what's feasible when we get to August. Things are changing every day. COVID isn't just a physical health crisis, it's also causing a major mental health crisis that we haven't begun to deal with yet, and keeping our students out of school longer will only exacerbate that. We need to get back to some kind of normalcy. Our students deserve it. Jennifer Ireland, have you looked into the number of staff at each school site who will be unable to be in the classroom or on a site if reopening is done too soon or the wrong way? There are numerous employees of this district who are older, have health issues, or care for someone who does. As a teacher, I want to be with my kids in my room, but only when it means making learning better, not at the jeopardy of the health of our students and staff. I'm asking that you consider the elevated COVID-19 numbers we are seeing. Please use the science and health benchmarks for a safe return. You have a district of distinguished educational professionals. It would be better to establish successful models for distance learning now rather than waiting until the last minute and being in another emergency situation. You have a district of highly qualified educators. Listen to that. They have made this district a success prior to now and will continue to if you support them and listen to them. Cami Jimenez. Will masks be enforced, and what consequences will students face if they refuse to wear one? Is it possible that elementary and high school students each follow a different plan due to their age and susceptibility? Jane Smith. If a student with special needs takes off his mask and spits in my face, is legal recourse available to me? Lorraine Hinojosa. If a student with special needs takes off his mask and spits in my face, is legal recourse available to me? David Hinojosa. Communication between immediate supervisor director should be a priority to dispel rumors or to distribute accurate information regarding the health status of students, of staff or students in a more timely manner. With an individual's right to privacy, some type of district contract tracer should ensure staff are safe when COVID-19 exposure is confirmed. Number 22, Gabriela Picardo. It's been widely reported that open spaces and fresh, non-recirculating air are unequivocally safer for the reducing of transmission of COVID. Given our circumstances of classrooms with no operable windows, shared recirculated air via air conditioning systems due to extreme temperatures, our classrooms are potentially ideal hotbeds for COVID transmission between teachers as well as students. How will this be addressed? And Julie Guillaume Matthews says, wings of air systems connected classrooms exponentially raises the risk of transmission by recirculating air with hundreds of people at once. Any measures you put in place by limiting students per room by observing distancing is effectively negated. How will the district and school sites be addressing this? Another from Gabriel Picardo. The most recent CDC guidelines state leave policies should be flexible and not punish people for taking time off, and should allow sick employees to stay home and away from coworkers. Leave policies should also account for employees who need to stay home with their children if there are school or child care closures, or to care for sick family members. How will the district address this? Julie Guillaume Matthews again. We can implement a host of strategies and rules regarding distancing and hand washing and masks, but the hard truth is that we cannot guarantee that these measures will prevent a healthcare crisis that cannot be managed, or even worse, be the cause of death for students and staff. However, we do know for a fact that staying home prevents transmission and thereby death. Until we have a reliable treatment and a full understanding of the long-term health consequences, we should not be in the practice of gambling with people's lives. Gabriel Picardo again. As a parent of a child with special needs, I understand that many of our students will have difficulty understanding and adhering to safety guidelines without repetition and possibly physical intervention. How are we going to support these students without putting them and our paraeducators in harm's way? Rosa Zamaro. We work with 3- and 4-year-olds that sneeze and cough in our face. Will they too be required to wear a mask for 3 hours per session like us, the staff? I have worn a mask to go to get groceries and find my throat hurts after wearing it. How will this affect the children and us? Social distancing with young ones, daily sanitation of toys. Some require assistance when using the bathroom as well, and these are just a few concerns. We're also under different regulations than those of elementary schools because we are licensed. Estela Juarez. I work in the ECE program and we are under different regulations because we are licensed than TK through 12. The children are age 3 years to 4 years old, and they cough and sneeze in our face. How are we to make sure they keep their face mask on? They also need assistance with wiping noses and bathroom needs. How are we going to be safe, especially if we have underlying health issues ourselves? What about PPE for us? Who's going to stay on top of that and make sure that we get equipment in a timely manner? We have trouble getting items that we need and work orders done. Daily sanitizing of toys cannot be done due to constant supervision regulations we have to follow. Please take ECE frontline workers in mind. Grace Noriega. Will there be a policy to inform staff and parents if a member of their site, student or staff, has become ill with COVID-19? What will the procedure for the classroom/school site of the student staff member that has become ill to prevent further exposure or spreading of the disease? Also from Grace Noriega, we have a very dedicated staff at DSUSD who often don't want to miss work because they are worried about the impact of their absence has on students. Many other companies have implemented policies that ensure that employees, even with the slightest symptoms of COVID-19, stay home without hesitation. Has the district considered incentives such as increased paid allowed sick days and ample substitute availability to help ensure staff, both certificated and classified, can miss work with a minimal disruption to the classroom? Julie Fleischman, to the school board and reopening task force. Hello. I first wanted to thank you for all your efforts. This isn't an easy task and your diligence is appreciated. I have an overachiever at Palm Desert High School. The distance learning we endured through the end of the school year has really disenfranchised my excelling student. I don't know how other students did the distance learning, so I can't comment on that. I can only beg you to please have in-classroom education starting this August. My child needs that connection to continue her growth and success. The distance learning has not been good in any way for her education, drive, or desire to succeed. My daughter is also a band student and a marching band member, so we do ask that you allow sports or without social distance spectators. The marching band will have no difficulty spacing out during halftime performance on the football field. They know how to position themselves exactly where needed. Thank you for your consideration. David Parsons. I teach at Shadow Hills High School, and we have historical problems in even getting our students to wear their lanyards. How then can we get our students to walk down a one-way hallway, or how can we convince students to keep their hot, sticky, scratchy mask on for 6 hours a day? And how can we get our students to wash their hands frequently throughout the day when our classrooms don't have sinks? The list could go on and on. The only solution is online education 100% of the time. Estella Juarez. I work in, let's see, this is a repeat from the earlier one. Jane McAdams. Please consider training teachers until Labor Day. Then kids come to campus for extended days, like nurses. End first semester at Thanksgiving and start second semester after winter break and end of April. No spring break, no holidays, just this year. However, must keep high school sports and activities, as this is what draws kids to school. Thank you. Connie Campbell, I want to say 100% online until there is a vaccine. If hundreds of cases and no deaths in mid-March was enough to warrant closure, why would we go back now? Are we better now or worse? The kids and some staff don't follow directions. We don't have space for 6 feet of distance per kid in our classroom when some classes are 40 plus. Look what happened when California opened up. COVID-19 numbers are up. So what happens when a kid is asymptomatic and gets sick? How can we keep kids or employees safe if we don't have a way to stop the transmission other than staying away? Jennifer Smith. If we are required to do virtual learning when the school year begins, will attendance be required this time, and will child welfare and attendance support teachers in schools in tracking attendance and communicating with families? What responsibilities did CWA staff assume during the remote learning that occurred during March 16th, June 5th? Jennifer Smith. If we return to traditional classroom school site settings, will schools be equipped with additional restrooms and sinks that offer hot water and soap for students and staff? Marissa St. Louis. Due to current increase in cases in Riverside County and our desert, I no longer feel comfortable returning to the classroom. I now know people who have gotten sick. Unless there is a vaccine, I do not think it would be responsible to send teachers and students back to the classroom. I normally have 40 to 42 students packed in my classroom 6 times a day. There's too much risk. Shane Kane. Good afternoon. Last fall, the issue of elementary counselors and teaching preps was brought to your attention. Unfortunately, the situation has not changed. As of now, many Desert Sands Unified School District elementary counselors will be asked to cover preps for teachers in the fall, rather than offering counseling groups one-on-one counseling or crisis counseling. For many young people, it has been a traumatic time as they live through global pandemic and social unrest. Now more than ever, our young elementary students need our elementary counselors' full attention. If we open with a hybrid model of teaching, I would like to ask the Board of Education to consider asking DSUSD to implement a no prep policy for elementary counselors until we return to a normal traditional classroom setting. Thank you. One from Carly. I feel disappointed for the way the first question was presented on the survey. It was misleading. It said if there were no restrictions, would we feel comfortable sending our children back? I said yes. But with the way the numbers are now, I don't see how we can open without restrictions, and I am in no way comfortable sending my children back. I have 3 children attending 3 different schools in DSUSD next year. I have concerns about hybrid schedules. How will I possibly juggle 3 different days and times coming and going while being a working mom? I would like to use the online program through the district, but I can't help but wonder if pulling them out of the district and using an online school program that is already equipped to deal with online learning is a better option. Carol Bailey. I do not believe that we should be reopening schools on site due to the critical outbreaks and intensity of the COVID virus community spread in Riverside County. We are currently having to move backwards in the reopening stages of our economy, and as we move too fast and now have an even greater pandemic crisis. Distance learning is the only healthy choice for our students, family, and staff. Although we all want our schools to reopen, as they always have, we cannot without clear safety procedures, protective equipment readily available daily, regular disinfecting of classrooms, and other areas of the schools almost on an hourly basis to combat the spread of COVID virus. Currently, all of that and more cannot be properly provided. We have to put our health concerns above all else as this decision is being made. Our lives and the lives of our students are in your hands. Make the right decision and keep brick and mortar schools closed until we can ensure everyone's health. Amy Hegland. What is the protocol if a student or staff tests positive? If we go back in person to school, how will bathrooms, discipline, front office visits for our kids look? Has the district ordered PPE for staff? When will we get it? Will families provide their own? What autonomy, if any, will different sites have? Will the district have standard unified rules and protocol? Has the district taken a worldview of what is already working in other countries, since the U.S. is behind the 8 ball in addressing coronavirus? Has the district considered using different models for elementary, middle, and high school and returning to school? Molly Waltz. How is Desert Sands going to support students and teachers who miss class for days or weeks because of COVID? Missing 2 weeks of school and teaching is hard to make up. Stacy Durant. The importance of high school sports is crucial for athletes wanting to compete at the next level. This is my son's senior year, a time when athletes are looked at and offer scholarships. Caroline Slee Polis. As class sizes are over 30 students, there is not sufficient space for social distancing. What is the safety plan for students and staff if we return to a traditional school model despite the rising COVID-19 numbers, instead of hybrid or virtual? For students who are immunocompromised, what is the protocol for their safe return to school? What is the protocol if someone going at a school site is diagnosed with COVID-19 after we are back in school? Is every child who is exposed going to be required to get a test? Or will they be required to quarantine at home for 14 days? Will a clearance letter be required before someone is able to return to school after a positive diagnosis? Thank you for your response. Antonio Durant. How or what will football look like this season? Is there going to be a season? Maureen Weiser. Question. Since it appears that it is highly likely that the risks of exposure to SARS-CoV-2 are increasing and will continue to increase in the population, will Desert Sands commit to mandating the use of face masks and perhaps face shields and enforcing that rule for all persons are required to be on a campus, students, parents, and staff? And a comment. I've been in the presence of and also seen several photos of members of the school board out in public places, indoors, during the times that face masks have been mandatory, without wearing face masks or shields, including irresponsible tomac. What a terrible, illegal example to be setting for our students and families. Shame on you, you should resign. Isaiah Durant. I need high school sports because that's where I spend most of my time at school. Tara Fazio. If the meeting is about reopening schools and being held virtually for the safety of participants, then maybe we shouldn't be talking about opening schools. Maureen Weiser, again. High school students on their way to college soon have a huge responsibility to do well on their AP and IB and other exams. Teachers did their best to keep the learning going this past spring, but inevitably there will be some time lost this fall for catching up. With all the challenges these students and their teachers will be facing this year, trying to get to a place where they are performing well in those exams, will Desert Sands commit additional funds for extra time like Saturday school so that we can get caught up? A good place to get these funds would be from several administrators giving back those hefty raises that gave themselves last year $125,000 per week. Interesting. Kaylin. High school sports are especially important to seniors so they can get to the next level. Cami Jimenez, will masks be enforced and what consequences will students face if they refuse to wear one? Is it possible that elementary and high school students each follow a different plan to their age and susceptibility? Martha Snug, in my opinion, the school needs to shut down immediately. Melissa Molina, school should be virtual for the beginning of the school year until we get a vaccine. Once that's settled, the kids can start attending school again and the teachers could figure out the proper placement for each child for the year. Julie Matthews, I think we can all agree that there is no great substitute in person learning. We are social beings and we thrive off interactions with each other. Even so, the hard truth is that none of us can guarantee any measure of our safety for our staff and students if we return in person. Really stop and think about that. Can any of you look at a teacher or a student in the eye and guarantee their safety? However, we do not know for a fact that staying home prevents transmission and thereby death. Until we have a reliable standard treatment and a full understanding of the long-term health consequences, we should not be in the practice of gambling with people's lives. Melissa Molina, school should be virtual for the beginning of the school year up until we get a vaccine. Once that's settled, the kids can start attending school again and the teachers could figure out the proper placement for each child for the year. And that concludes. Oh,
You have that one?
no, I do not have that one.
Keep going.
Oh, very good.
And then you have this one, too. So,
Oh, very good. I have 15 more here. I am in favor of a traditional school year for K through 5 students. I believe that the younger kiddos should have the opportunity to attend school with the interaction of their peers and a classroom teacher. I don't feel masks are necessary as long as we have access to plenty of hand sanitizer and or the ability for students to wash their hands. Oh, I'm sorry, these are no readings. My mistake on those.
my bad.
Oh, I'm sorry.
So that's one more.
And the last one, public comment, entitled, I Can't Breathe, I Can't Breathe. Do we know who this one is from? Sorry? Lauren McGuire. All right, thank you. These words started out just as one voice of someone oppressed, but no one bothered to listen. Then more voices uttered the same words, and still no one did anything because they had grown oblivious to the atrocity of systemic racism, which has gone on for countless years. Then a voice was not only heard but seen, and humanity had no choice but to pay attention to one man's plea because his 8-minute and 40-second plea of I can't breathe was finally heard and witnessed worldwide. The long history of abuse to people of color, starting with slavery and the slave mentality that tore away the human worth of the black population for too many years. Out of this atrocity, the world has finally seen through newly opened eyes the saga of the murder of George Floyd by a white police officer. Like the story of the phoenix, out of the ashes, something new and powerful can arise. A diverse group of young Americans have taken this to heart, and through peaceful protest, they have enabled mankind to see clearly the long history of suppression endured by black Americans for too long. It is clear that an atrocity to one is an atrocity to all, and yes, Black Lives Matter. It has been said that all men are created equal, but are they truly equal? To truly create an atmosphere where all men are equal, humanity has been afforded a chance to set things right. We can be like the phoenix, which regenerates or is otherwise born again. It is not too late for our country to set a new course and arise from the ashes of our predecessors. The question is, are we as a nation ready and willing to regenerate and truly be born again? As a district that prides itself on leading the way in education, wouldn't it even be greater to lend your voices in an effort that corrects many social injustices that have gone on much too long? On which side of history does the district want to be remembered? The oppressive society that perpetuates systemic racism, or as the freedom-thinking leaders that have helped to create and perpetuate a new social justice and equality for all people of color? What legacy do you want to leave our children? And that concludes public comments.
Thank you very much, Mr. Tomac.
Point of order. Sorry, I have two separate texts from two different people saying that they submitted comments before 2 o'clock this afternoon and theirs were not read. So I just want that to go on public record, please.
Do you have their names so we could see maybe if they were put on the no list?
Sure. Angela Jupp and Judy Norman.
Angela Dunn.
Just, J-U-S-T?
J-U-P-P.
Well, you read them. We don't have them.
They submitted them before 2 o'clock this afternoon.
Okay, we don't have them. Okay, so we will move on to study session. 6.1, school opening planning for the 2020-2021 school year. Turn that over to Mr. Bailey.
Thank you very much. Sincerely appreciate all the comments, and as you can see, there are varying perspectives on return to school. I can say that the planning process is complicated, to say the least. I just want to give a shout out to the task force that we've assembled to look at some initial probabilities or proposals in teaching and learning models, led by Dr. Cook, who's here in the audience, and she'll be actually leading a presentation to the board today. Also, the 43 other members that included teachers, management, and association presidents, getting us to this point. And we continue. Today, really, the objective is to have an open discussion with the board around some potential models of teaching and learning as we return from the summer break per calendar August 19th. So the board will be hearing these potential models with a fairly decent level of detail around each model that we've proposed, as well as some additional thoughts. And also I want to point out that we're going to the public again tomorrow in a virtual Bailey and Coffee. We call it Bailey and Coffee to Go. That's at 4 o'clock p.m. So based on the discussion with the board today and your feedback and potential guidance around these models, we'll take that to the public and also to staff tomorrow in an interactive environment, whereas we're completing a thought exchange or a survey real time in Spanish and English to determine our public's sentiments around these proposed models. And this all leads up to a July 9th recognition of the board regarding which model or models we will be going into in the fall. And I will say it's difficult as well because these health orders and guidelines that we receive from California Department of Education, Public Health, Riverside Office of Education, as well as Riverside County Public Health are constantly changing. I can't underscore that enough, and rightfully so, as the data tends to migrate one way or another regarding the spread of COVID. So with that, I want to basically do an overview of some of the models we've landed on for discussion today before Dr. Cook gets up and speaks in more detail. So really what we are trying to do within those guidelines I just described, and also a new Assembly bill that's come to us, Assembly Bill 77, which is a trailer bill to Senate Bill 98, we are working within those guidelines to try and answer to staff needs as well as community needs. And as you can see, there are varying opinions about what that need might be. So think of this as an opportunity to provide a menu of options that accommodate staff and parents as much as possible, dependent upon whatever the guidelines are at that time. So the first model, of course, would be an option for distance learning. If a parent is absolute, which we heard in comments today, that and we've heard in survey data as well as staff, we're not comfortable coming back, then we would like to offer that option for parents and try to, as much as we can, match that with the staff that are so inclined to provide support for that model. That's an ambition, but those things obviously would require further discussion with our associations and a lot of additional work to make that even happen. Right now it's just a thought that could potentially work. The second option obviously would be in-person learning, ultimately a 5-day-a-week in-person learning that adheres to the public health guidelines. Now, that sounds great. However, in order to comply with the social distancing rules and the one-way walks and those kinds of things, limited social gatherings, we would have to have a certain number of students in order to comply. So that could take us into an option B within the option I just described, which would be the alternating cohort schedule, whereas we subdivide students into cohort groups that attend, for example, and I'm just using this as an example, a Monday, Tuesday, Wednesday distance learning support, office hours, and then the next cohort would be a Thursday, Friday concept. But that's only if we had to consider that based on the numbers that desired in-person learning. And then lastly, again, mentioned within the Assembly Bill 77, there are specific guidelines that just came to us last week, Friday. There's a lot of accountability around education and distance learning as affiliated with the budget bill. So we would have to be mindful of that as well. And lastly, within those bills, the concept has arisen that we could potentially start in a distance learning model for a short period of time and then slowly bring students and staff back in based on current health guidelines. So there are lots of moving parts within these models. And again, just as soon as Friday, we had some emerging information that may affect our modeling. So with that, I just want to jump right into the presentation to the board, and then we'll take your questions and answers and open for discussion following. Again, if we have to go back and modify our proposals and our thoughts based on input from community and board, we are happy to do that before we get to July 9.
Hello. Can you hear me okay? I can. Excellent. Good afternoon. Thank you for allowing me to present today on the school opening plan as created by the task force. My name is Rebecca Cook, and I'm happy to present the vision today. I'm having a hard time breathing, but I'm going to stick with it here. So I'm just going to, as Mr. Bailey mentioned, run you through the plan or the proposal as we're seeing it today. I wanted to start by just sharing that as we embarked on this work as a task force, we were and continue to be very intentional in aligning the vision in the direction of the opening of schools with the California Department of Education, the California Department of Public Health, Riverside County, with all those guidelines with our existing district priorities, as you'll see on the slide there. So our three main priorities, trying to always maintain that alignment. Mr. Bailey did mention earlier the timeline to opening schools. We started back earlier this month with a parent and staff surveys, always trying to continue with our Plan, Do, Study, Act cycle for continuous improvement with planning, doing, getting some input, reflecting back through, and then redoing. So as Mr. Bailey mentioned, we had a virtual Bailey and coffee earlier after the staff survey went out. June 15th, we started our task force. We met 3 different times along with smaller groups meeting in between to their assigned particular areas. That brings us to today, June 30th, where we are presenting the study session to discuss a preliminary plan. Tomorrow, as Mr. Bailey mentioned, we will have a second Bailey and Coffee to go to update the community on the progress of the school opening plan and have some feedback and questions. That additional thought exchange or survey will also be launched. And next week on July 9th, we will be having a special board meeting at 5 o'clock to consider, for the Board of Education to consider the school opening plan. And of course, the very last dot on that timeline is August 19th, which is our opening of schools. One thing I want to note on this particular slide is that all of our plans, as mentioned and as you can imagine, are subject to change based on the public health guidelines. So let's jump in for a minute here. One of the things that was very important to the task force as it was created was to have representation from members of all the employee organizations so that they could collaborate together and provide input. And as mentioned by many of the people whose letters we read today, we care about our students and their needs, academic and social. But we also know that our students will return to school with needs beyond just their academic interests, and we have to address this. We know that the different student groups will have varied needs based on their circumstances. For example, the task force considered closing the digital divide. How are we going to do that? Students' health and safety and other needs such as childcare. So this slide just talks a little bit about some of the needs that were addressed in the task force. Well, let's go back to the beginning. Oops, missing a slide here. Am I missing a slide? Let's not go back to the beginning. Let's talk about our instructional delivery models. Mr. Bailey mentioned that as planned in the task force, we looked at 3 basic delivery models. We are intentionally calling, I'd like to call your attention to that rectangle on the left, virtual learning. We are not calling it distance learning. It will not look like what we experienced in the spring and what we had very little time to prepare for. If you look at the attention, put your attention to that red oval, virtual learning will include grading. It will include students being responsible for attendance. It will include assessments. Hybrid learning, we're going to talk about that quite in depth this afternoon. We're going to focus mostly on that top model today with the 2-day in-person, 2-day virtual learning, and 1-day intervention. However, there are other models that we can consider. Modified traditional model, one of the things that we looked at that was needing to really consider things like passing periods and maintaining social distance, which again was mentioned by a number of people in their letters today. So we started with parent survey data. We had, the survey went out, as I mentioned, early in June, and we had 3,855 respondents. There were 2 scenarios that people were asked to comment on. And the first one was, if there are no restrictive public health guidelines, I want my children to attend a traditional school day. And so the responses of that were that 57.6, almost 58% of the parents asked for traditional instruction in a traditional school setting. 21.6% were interested in a hybrid model. 16.7% responded they wanted full-time distance learning, and that little green part there, 4.2% wanted homeschool or an independent study model. Now, in scenario B, we asked about returning to school with health guidelines in place, which, as we all know, is our current reality. This resulted, of note, fewer people wanting traditional instruction. Actually, a 20% decrease in parents wanting that traditional instruction. The next next part of the survey is we did ask people the parents for their primary reason for their choice. And you'll just see on that slide that parent preference was a large percentage, student interest, health risks associated with COVID-19, childcare, and then 8% said they gave other as their reason for their response on the survey. So once we had our survey data, we actually presented that to our second meeting of the task force, and they really went to work and started working together in their small groups to talk about how we're going to make this work and what it's going to look like. So for the next few minutes, I want to focus on this hybrid model that we mentioned earlier. The task force has prepared some samples of what the models might look like. In this particular hybrid model, this is for middle school and high school, what we call secondary school. Students are in either group A or group B. Group A, for example, would physically attend school 2 days a week. While they are physically in class, group B will be at home, learning at the same time virtually from the same teacher of the kids that are in the class. And then they would flip-flop in the other 2 days of the week. In this case, on this example, on Thursday, Friday, group B would be in class and group A would be at home. So that's how we can reduce those class sizes and kids physically in schools. The nice thing about this is the schedules do provide a day for deep cleaning between the two groups of kids. To go a little deeper into that particular schedule, I want you to note that 1 day a week, doesn't matter what day it is in this particular sample, Monday, the 1 day a week, is a day that's dedicated to meeting the needs of various student groups. You'll see intervention on there. It could also be extension. It could be extending students' learning. Tuesday and Wednesday, again, as mentioned, cohort A is teaching to half the class in person, and then cohort B, those kids are at home. Now, if you'll notice on the schedule, that's an hour and a half of a class period, which is a long time. I know we've all been on Zoom meetings throughout these past few months, and an hour and a half is a long time to ask a student at home to virtually attend to a lesson. And what the task force talked about and what that can look like is, say, 15 minutes of direct instruction and then some independent work or work in small groups, and then the kids come back. So while that's an hour and a half, it's not necessarily an hour and a half of direct instruction. And again, if you'll note, there's 1 day a week that's dedicated to intervention or prevention or support for students. So also sticking with the hybrid model, similar to the secondary schools, an elementary schedule looks quite similar, where half of the students, or student A, would attend school Tuesday and Wednesday, with 50% of their peers in the classroom and 50% of their peers at home, learning at the same time. And then Thursday, Friday, they flip-flop, and those students who were at school are now at home, and the students who were at home are now at school. Going deeper into that schedule, more detailed view, again, we have 1 day scheduled for teacher collaboration and preparation in the mornings, and then student intervention and support in the afternoons. And again, this is a sample schedule. It doesn't, could switch whatever day of the week works best for maybe that school or what have you. One of the things that the task force worked hard on is looking at our student groups and addressing their needs. So this slide addresses this in, again, not a lot of detail, but know that this was talked about for quite a while. Students with special needs who are traditionally in a self-contained classroom would attend school every day. They already have smaller class sizes, and they should be able to social distance without a problem. Students who learn in an inclusion or a blended model will have schedules similar to the students previously noted on the previous slides. For core instruction, students in part of cohort A and B would be in that class, and then outside of that classroom, they would work with their special education teacher or a paraeducator to get the extra support they need. They can get that support virtually, or when they're at school, they can get it in their for example, in their classroom with their teacher who teaches special education. Again, when we look at foster youth and our English learners, they're going to continue to receive additional supports, whether they're on campus or whether it's virtually. So all that is a very brief overview of the hybrid model. In this PowerPoint, if you were interested, there are more sample schedules. These are virtual learning schedules, and I will tell you, the task force worked so hard to create sample schedules for each level, for elementary, middle, and high schools, and they created various options to meet the needs of each high school. So for example, the high schools that have a 6-period day have very different needs than a high school that has a 7 or an 8-period day. They built sample schedules for each of those schools, and those are on those links. I will show you a sample of each of those, but I'm not going to go into all of them this afternoon. And remember, with the virtual learning, grading, attendance, and assessments matter, and they will be taken into account. So let's take a look at some virtual learning schedules. So here's a sample high school virtual learning schedule with block scheduling. You'll see the same thing I mentioned earlier with 1 day a week dedicated to teacher collaboration and student intervention. So you see students going to school, periods 1, 2, 1, 3, 5. A typical Bell schedule, what that looks like. This is a sample for Palm Desert High and La Quinta High. Again, this is a 6-period day. Note that there's actual office hours every day that students are at school. And there's also that Monday or whatever the day week it is could be for teacher collaboration, staff professional development, and again, intervention for students as needed. A sample middle school virtual learning schedule. This schedule could work for all of the middle schools in Desert Sands. What's interesting, it has 1 day, 1 day a week there for students who need extra intervention time. Again, also office hours 2 days a week. These samples could be tweaked based on the needs of each individual middle school. Again, these are the virtual learning schedules. And finally, the elementary virtual learning schedule with 1 day devoted to teacher collaboration, professional development, and staff meetings. And you'll notice on this particular schedule, they do have small group instruction embedded in the school day. And they also have times, 3 days a week there for office hours, where students can get additional help or individual support. And I do want to give a quick shout out to those teachers who were on this particular part of the committee of the task force who spent the time to really build these schedules. So I thank them for that. So I just presented to you the hybrid models for all 3 levels, but we know that there's definitely the hybrid and virtual, actually. But we know there are considerations, and as we discussed the models, we did talk about some considerations for each, including, for example, in the traditional model of schooling, social distancing. How are we going to do lunch and recess and passing periods? The task force discussed the importance of teacher and parent training for the hybrid and virtual models. It's also worth mentioning that if half of the families chose virtual and we run traditional alongside of it, then social distancing is possible. It would be extremely difficult, however, to run a traditional and a hybrid model alongside each other. So just considerations that we talked about within the task force that we wanted to share with the board this afternoon. Moving on from the models, oh, that's going Fast. We can talk about attendance for just a few minutes. Again, earlier, Mr. Bailey mentioned Assembly Bill 77, and it does outline requirements for instructional minutes that we must follow. In every plan that we have, the instructional minutes will meet the requirements of AB 77. For example, just one example, in virtual learning, attendance is based on the time value of assignments, which is similar to our current independent study model. While daily participation will be documented, we still need to identify re-engagement strategies for learning and develop an attendance plan. So there's still work to be done. Let's talk a little bit about assessments. Well, the good news is we have iReady, and we will use iReady to diagnose achievement gaps in our students, monitor their progress and their growth. And we will continue, as is our practice, to use formative assessments to monitor the progress of our students and summative assessments for grading. The task force also discussed the use of PPE during one-to-one testing and options for in-person testing for our virtual learners in the testing environments that require in-person testing. So there's some tests that actually we must do in person, and so we have talked about options for PPE for those people and for the students to come in and have individual appointments. Of course, we don't want to, as I mentioned at the very beginning of this presentation, social emotional learning is important, and we know that our kids are going to come with some special needs at the beginning of the year. So the task force spent considerable time discussing this and the need for the support for not only our students but also our staff. Specifically, we addressed in the task force the needs for training on social emotional strategies and the implementation of those strategies for our students. We also talked about the need to train our families on supports available and SEL strategies. But I do want to note, we already have a plethora of wonderful resources on our district website. I went and took a quick peek at it today, and it's quite robust. Special education. So when we set up the task force, we split it up into 8 subgroups, and one group was dedicated to the support of our students with special needs. And the bullets on this slide are a good representation of the discussions that the group had. A meeting of the needs of our students with moderate, severe, and medically complex disabilities was discussed. We will continue to hold IEPs, whether virtually or in person. Considerations for inclusive classrooms, as I mentioned earlier, and supports for students through accommodations and modifications was also discussed in detail. The group talked about providing related services in completing assessments for special needs students. And of course, an additional consideration for the IEP language for virtual and hybrid instruction is something that's continuing to be discussed. In addition to our students with disabilities, of course, we have looked at the other student groups, also known as the unduplicated count. And of course, they require some special attention and intervention. Our English learners, foster youth, and socioeconomically disadvantaged students. For example, the task force considered the instructional delivery that's best for our English learners and how to provide integrated ELD and and designated ELD for our students. Of course, we will continue to provide supports for our foster youth, and for our socioeconomically disadvantaged students, we will continue to provide outreach and supplies as needed. We have, as we all know, we have many specialized programs on our campuses, and we are aware that they will all require modifications to the way they typically run, depending on which environment or model is in place. And we know we need to pay special attention to adjustments that will need to be made to support these programs. So regardless of their environment, and being aware that we may have to move in and out of environments based on the current situation, technology is vital. The task force focused on 3 particular areas of technology, access, usage, and support. We will continue to provide Chromebooks and tablets and MiFi devices to ensure the success of all students. We looked at the ability to monitor usage and provide necessary supports to staff, students, and again, parents. Training came up a lot in our task force virtual conversations. Pretty much every other minute, we are talking about some sort of training for someone. And it's important that the parents are trained on how to support their children and that we continue to train our staff on virtual and hybrid environments. And as I said earlier, and was mentioned before I even got up here today, the health and safety of our community and our students is of the utmost importance. This task force discussed items you see listed here, including protocols for the health office, protocols for student and staff exposed to COVID-19, and those with underlying health conditions. And we will continue to address these considerations. Let's talk a little bit about student training and what that might look like. Again, as mentioned by a number of people in their letters, we need to continue to train our students and have ongoing communication around the importance of social distancing, training on face coverings, and healthy hygiene practices. Washing our hands. And I've mentioned the importance of parent training regarding supporting their students academically. A few other examples of training and supporting families include COVID-19 symptom identification, healthy hygiene practices, and screening practices if we choose to adopt them. In addition to training, we need to communicate with our families. And that communication needs to include multiple platforms in multiple languages. In all of this training and safety precautions, we do not want to lose sight of the fact that we want to maintain a welcoming environment to our families. That's going to be a nice balancing act when we get there, to say to someone, we can't have you here, but we welcome you here. So how are we going to address those needs? Those are ongoing conversations within the task force. With regards to our district personnel, we have talked again about the need to support and train all of our personnel on healthy hygiene practices and planning for illnesses. And we also are very aware that we need to negotiate the effects of any changes that instructional models have on our current collective bargaining agreements. Let's talk about nutrition services. The task force spent a good amount of time on nutrition services, and we discussed the grab-and-go options for virtual and hybrid models. We do know that we will have to discontinue our salad bars, and if the district adopts wellness checks prior to campus entry, we understand this may have some sort of impact on the breakfast that we provide our students. Another section of our 8-section task force focused specifically on the operations of our district. And this included long conversations, and the breadth of what the operations do is incredible to me. But supplies for healthy hygiene practices, cleaning supplies, floor markings for social distances, sneeze guards, which you've already seen gone up in some parts of our district. All those things are being considered through the maintenance and operations department. With regards to transportation, and some of this is also guidance provided by various government organizations, how do we keep our students and staff safe while transporting our students to and from school? Topics included, again, social distancing, face coverings of students when they're on the bus and our bus drivers, and keeping the bus windows open and cleaning, and all those important options for transportation. And so, surprisingly, this comes to the end of my presentation. I want to thank you all for your attention. I, again, want to make a quick shout out to the task force. They worked very hard to really brainstorm their ideas and then put them together into something that makes a little bit of sense. So I believe we now have time for questions and comments from the board.
Actually, if I may interject, Dr. Vollmer's been working diligently behind the scenes with the Google form, trying to pull the public comments
Okay.
that were reported not included. So she's provided me with additional comments that I'm going to pass over to Member Tomac for reading before we engage. As we're waiting, thank you, Dr. Cook.
There you go. All right, thanks.
Okay, this is from Judy Norman. I am a teacher and a parent and a community member who would like nothing more than to return to my school and be with my students as we did pre-pandemic. That would be ideal. However, we are in the middle of a worldwide pandemic, and I am distressed to hear that DSUSD plans to have students and staff on campus for the fall semester. We should follow the example of CSU and UC systems and invest in doing a good job with distance learning for the fall semester. Mr. Tomac, I know you value math and data. When I look at the data, I cannot see any way to safely return to campus. For example, in looking at new confirmed cases in the Coachella Valley, we see 482 for the week of June 2 through 8, 716 the next week, June 9 through 15, and 882 for last week. This is a steady rise. Correct me if I'm wrong, but with those statistics, it would be woefully irresponsible to return to school. We have no indication that these numbers will go down, especially in light of more businesses opening up and many people not adhering to the governor's mandate for facial covering and social distancing. I completely understand that some parents and some students and some teachers want to return to school in person. But even with only half the students at a time on campus, there is no way to ensure facial coverings will be worn or that 6-foot social distancing measures can be followed throughout the school day. We would need to enforce these protocols in classrooms, in hallways, at lunch, in the restrooms, or in the PE locker rooms. My fear is that we will go back to campus and there will be an even bigger spike in cases with student or staff deaths, and then we go back to, quote, emergency distant learning, unquote, again. We have the tools to get it right this time by putting all of our resources of time, money, and expertise in doing a good job with distance learning. Cheryl Powers, please read aloud. It cannot be assumed that all teachers have computer equipment at home that adequately supports teaching via distance learning or a hybrid model. Needs include large monitor or double monitor, sufficient broadband and Wi-Fi, as well as designated space that is appropriate. Some teachers will prefer to use their classroom space to implement distance learning even if students remain at home, so that they would have a better access to teaching materials and can rely on district-provided technology. Many teachers will need to bring district-issued tech devices home and will need improved internet access. Please consider implementing different models of instructional student engagement by age. Children in TK, K, and first grade were reported to have unsuccessful experiences with distance learning in the spring. They need to be present on campus for 50% or more of their weekly instructional time. This may require that additional teachers are assigned to these grades to adjust class size ratios to ensure adequate social distancing. These young students and their families may also need on-site training in how to use a tech device at home, log in, and navigate to platforms like Clever, Google Classroom, Gmail, etc. Questions. Will the process to assign teaching staff to the various models to meet, or what will be the process to assign teaching staff to the various models to meet parent demand? Will teachers be allowed to, quote, transfer, unquote, into distance learning as a new position? Will they need to apply and be interviewed? Can DSUSD form a partnership with Golden Voice / Coachella Fest and the Tennis Garden to access portable hand washing stations? That equipment may be in storage locally by those organizations which have historically been supportive to the public, community, and schools. Angela Jupp. As teachers, we understand that a return to normal is desirable for many. However, with the recent explosion of COVID cases in our area and some states beginning to shut down all over again, it is still too risky for students and staff to return to campus. How will we ever keep the students 6 feet apart and require them to wear face masks? What is concerning is that the people making the decision to put students and staff in the classroom are not people who are actually in the classrooms. It is easy to say, quote, tell the students to wear their masks, unquote, or, quote, tell the students to stay away from each other, unquote. Students are very social by nature and will have difficulty social distancing. In our August to October hot and humid climate, keeping masks on will be difficult and miserable for everyone. Many will say, quote, students can go back to school. This disease is not affecting children like it is affecting adults, unquote. However, the disease will affect teachers who are closed in the classroom with students, exclamation point, sorry. We know that children are carriers of this disease and risk spreading it when they have no symptoms. In New York City, parentheses, which did not shut down schools ahead of the pandemic, in parentheses, as of mid-May, 74 employees from the New York Department of Education, including at least 28 teachers, died from the coronavirus. What will we do if/when our teachers begin to get sick? Furthermore, the idea of trying to designate teachers into, quote, high risk and low risk, unquote, implies that it is okay for medically low risk persons to be in classroom and possibly get the disease because they have no, all in capitals, identified underlying health issues. Doctors are finding that this disease is causing permanent lung and organ damage to high and low risk people alike. Please keep in mind we are all high risk. Linda Martin. As you study the opening of the 2021 school year, please consider this question. Are you willing to spend part of each day of the pandemic sitting in desks in our classrooms as class is in progress? I invite you to ride a bus to Desert Ridge Academy where hundreds of students ride the bus to get to school each day, and the classes often have 37, 38, or 39 students. What level of safeguards would you want in place before you entered my classroom of 8th graders who don't always comply with the guidelines? Would you want students screened before they got on the bus? Would you want all staff and students screened before they entered campus? How thoroughly would you want staff, parentheses, including substitute staff, trained in sanitary precautions? What kind of cleaning materials would you want available to the staff? What kind of PPE would you want to wear, want to see me wear, and want to see students wearing? Traditional classes and schedules are simply non-starters if we really do care about the well-being of our entire education community. Trish Ryan. As a parent of an incoming senior and 2 graduates, I have watched how sports and activities drive my kids to be better people. Yes, they have received an excellent education here in DSUSD, but it is sports and activities that are memorable and meaningful to them throughout their years. Sports is a huge part of my son's life. He plays 3 varsity sports. He is a paid referee for soccer on the weekends, and he saves his money to go to bowl games and Padres baseball games. He has been up at 6:30 weekdays to continue his workouts to prepare for his upcoming sports seasons. If this is taken away, it is unhealthy to him mentally as well as all of his teammates and all other athletes, band members, ASB, and more. As I said at the last school board meeting last week, I coached for 10 years and I still have players who are in touch with me as a teacher. I still have students who are emailing me this summer as they have no one at home and are lonely and sad. I interact daily with these students as their families cannot help. They must work long hours and leave their kids home alone. The National Association of Pediatrics stated yesterday that students should be on campus this fall. Again, offer the distance learning for those who want it, just like sports and activities should be offered for those who want it. If someone does not feel safe, they can sit the season out and/or distance learn for the fall or the year. Thank you all, Patricia Hash-Ryan, DSUSD employee for 30 years. Sideways smiley face. April Minker. Dear board members, thank you for your time and hard work regarding a reopening plan. My name is April Minker, and I am a middle school teacher who has also taught elementary, as well as the parent of 2 daughters who attend PDHS. As any teacher will tell you, differentiation is one of the important aspects of teaching in order to meet every student's unique needs. Students would not be successful without it. As you plan reopening, please consider the needs of our varying families. Some families need a traditional model as their students are unsuccessful at home, while others will succeed by attending school 2 days per week in a hybrid model. Some students may not want their students at school and prefer distance learning. Parents should get to choose which is best for their children. Personally, I would like my girls to be back in school. Many of our teachers have varying feelings as well. I believe we can accommodate the needs of all. I am asking that you provide a differentiated approach to the new school year, providing choice. Offer all 3 models and let teachers and parents find the model that best suits their needs. Additionally, I'm asking that sports be allowed as many students need this outlet. Since they are not mandatory events, parents should have the right to choose. We all understand that the County of Riverside can change plans at any time, but know our district cares about all students, teachers, and their families. Thank you again for your time. DJ Ryan. Critical to return to normal school and activity schedule. Reasonable precautions should be taken, but continue, quote, distance learning, unquote, is detrimental to the physical, intellectual, and emotional health of students. Heidi Nagy. As a parent to a newborn and a teacher of our district for over a decade, I understand competing and at times conflicting needs of the upcoming school year. However, when I search my conscience, I cannot in good faith ask that we start this next school year in person. I understand the fear of a lost academic year. I understand parents needing students to return to school as a form of childcare. But I also understand in my professional capacity that I will not be effective teaching in an environment that requires masks. Even though they are medically effective, they have become polarizing political statement that will become a distraction from my teaching. Additionally, my department at Shadow Hills High School has lost 2 English teachers recently, resulting in an increase of class size. How will I maintain social distancing when I have account for more students? How will I be able to manage technology with those students? Parentheses, do you know how many students don't come to school with their devices? Question mark, exclamation point, in parentheses, including charging. We often forget that a device needs to be charged if being used all day, and with standard wall units available for charging, there is no way for me to enforce social distancing. I empathize with students who are lonely, miss their friends and activities, and parents who will go back to work. But that fact remains. I am a teacher and a parent. I have my own family, and if my safety cannot be guaranteed, you are asking me to put myself and my loved ones at risk. The safest thing to do for next year for students, their families, our staff, their families, and the greater community at large would be to have school year 100% online. Lauren Kilifner. Schools have a responsibility to keep our communities safe.
A full reopening of our schools without full and proper safety precautions, parentheses, many of which admittedly will be difficult for our kids to follow at all times, in parentheses, would jeopardize the health and safety of all. There have been many families like my own taking every precaution to protect ourselves and our loved ones who are at high risk. However, there have also been many who aren't being as cautious. Mingling students together without full and proper safety precautions risks exposing families that are taking every measure to stay safe with those who are not. A classroom teacher, I would feel terribly responsible if someone happened to a student or one of their family members due to an infection that was somehow spread from my classroom. We need to remember that students and staff go home to families, and the risk of infection has the potential to impact many others who are not directly seen at our schools. Ultimately, whatever decision is made will not make everyone happy. However, a decision can and should be made with the best interest of the health and safety of the entire community in mind, an interest that should largely outweigh the inconvenience to some. The best way to protect our community is to minimize direct physical contact and offer distance learning this fall. With proper notification and time to plan, teachers can improve the distance learning experience for all students. We should also be working to provide other solutions to parents and guardians who are unable to stay at home with their children. However, this solution should not mandate the physical return to our campuses by all. Greatly reducing the number of students physically present would help ensure proper safety protocols and adhered to on campuses for those who must attend, allowing schools to continue to protect while simultaneously meeting the needs of our community. In summary, in order to meet the needs and protect the health of all involved, I strongly support the use of distance learning this fall. I realize some students will need to be in physical attendance on campus. However, this number should be small enough that proper safety precautions can be effectively implemented in the campus setting. Please fulfill the responsibility to keep our staff, students, and their families safe. Jennifer Griego. I desperately wanted to get back to normal and go back to school in August. However, I believe we can effectively and safely meet that goal. In early June, I was optimistic that a hybrid model was probably the best option for us, since lower numbers in schools, social distancing, and face masks could help with containment of COVID-19. However, in light of the current increasing numbers of COVID cases, I feel that option is out of the question. To ensure safety to all parties, staff, and students, the virtual classroom would be the best option at this point. Since it was decided upon and instituted so quickly, we encountered some definite issues with distance learning that need to be addressed. Deciding on distance learning paths now would ensure time to plan, prepare, and work through some of the issues that were problematic in the spring. Please consider the safety of all and move toward the virtual classroom for school reopening. Consider phasing in the hybrid model as things improve and numbers of COVID cases are consistently decreasing, then moving to a traditional in-school learning when it's safe for us to all return. Danny Oswood. Hello. I am concerned that the final decision for school opening in the fall will not be based on science and health concerns, but on the pressures from families to provide a place for students during traditional work hours. I understand the hardship and challenge that families face in needing care for their children so they may resume their normal work days. I fail to understand why this return to normalcy should come with the unsafe working conditions for every adult on every school campus. We have a large number of DSUSD staff and faculty who are at high risk for contracting and having serious health conditions from COVID-19. Is there a way to return to school in the safest possible manner? Yes. Wearing a mask. This means everyone all the time and in every class. Exceptions must be made at lunchtime with social distancing. Mask wearing is not negotiable. It is not open for debate. Mask wearing saves lives. It is not a violation of human rights. Why is it acceptable in our district for people to be outraged at having children wear a mask, but not for black children to be killed at a higher rate by police officers than any other group? Social distancing. Many of our DSUSD classrooms are at max capacity as is. This will take some creativity. It is time to have class size max number instated in our contract language. PPE for all staff and faculty. Resources need to be allotted for the staff and faculty to be supplied with the necessary health equipment. I want school back to what it was before March 13th just as much as the next person. In the scope of a child's lives, 3 months, 12 months of inconvenience and change is a small price to pay for a healthier and safer future. Thank you for your time, Danny Oswood. Gary Weiss. Please consider these two models for secondary hybrid instruction. I base these models on ELA classes of 40 students registered to each period. However, I believe it could be applied universally. All weekly reading and writing assignments and their resources would be posted on Google Classroom. In-person sessions would serve as, quote, learning labs, unquote, for a variety of tailored approaches such as general and differentiated instruction, time writings, collaborative discussion, teacher tutoring, testing, quizzes, presentations, etc. Model 1 allows approximately 8 to 10 students to participate in class / in-person instruction 1 day per week by creating alphabetical groupings. For example, students with the last names A through G would show up on Monday. Students with the last names H through L would show up on Tuesday, etc. These designated days would apply to all students of the students' classes. On other school days, students would work online from home. Model 2 allows for up to 20 students to participate in class / in-person instruction twice a week based on the same concept except for creating fewer alphabetical groups such as A through M student group meeting on Mondays and Wednesdays, and N through Z student groups meeting Tuesdays and Thursdays. Fridays could be exclusively distance learning days or in-person learning labs offering additional support for at-risk students such as special ed and English language learners. Fridays could be rotational groups of general students that meet for additional Friday in-person labs 1 Friday per month, which would be more, quote, fair, unquote, in that all students would have a Friday rotational opportunity on their, quote, off days, and students would work online from home. Please also consider creating a universal online learning resource packet for both students and teachers that give clear step-by-step, parentheses, preferably illustrated, in parentheses, text instructions as how students can join classrooms for the following: Google Classroom, StudySync, Quilt, commonlit.org, noredlink.com, News ELA, Turn, LTLN.com, etc., etc. A universal packet of online link would provide clear instruction, consistency, and support for both teachers and students. Finally, many of us teachers would like to use Zoom, yet we feel vulnerable regarding, quote, media opt-out, unquote, and cyberbullying implications for students' potential improper use of camera recording, photos, etc. of Zoom sessions. Is there any way to create a modified technology release with a specific reference to Zoom that would protect teachers more? Thanks for your consideration. Tracy Workman. I am the sole provider for my family and a teacher in our district. As it relates to school opening in August, I am torn between my responsibilities as a mom and an educator who is passionate about my work. Can we come together and put public health first in our decision-making while still working hard to bring some sense of routine and predictability for students and families? Do these conversations have to be part of a zero-sum game and so contentious? As recently as last week, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, told a congressional committee that more and more young people are contracting the virus. Fauci added that asymptomatic young people who never develop symptoms can also pass the virus on to others. So without realizing the implication, the simple act of sending an asymptomatic child or staff member to campus could cause someone to die. So please mandate, 1, either continuing with distance learning or hybrid schedule where students alternate between in-class instruction and distant learning. 2, spaced desks 6 feet apart and require all students and personnel to wear face coverings at all times. 3, limit seating on buses to help ensure social distancing. 4, require that either on the bus or at the school entrance, students undergo temperature screenings using no-touch thermometers and be asked about any potential symptoms. Desert Sands isn't the only school district facing these dilemmas, and to me, it mostly feels like a pragmatic question. In this unprecedented context, what are parents capable of overseeing? teachers capable of providing, and the school or district capable of supporting in a way that puts public health in the center of that decision making. Jana Johnson. I have an 8, 13, and 16-year-old at 3 DSUSD schools. I am pleading to please reopen school. My children did not take to online schooling, and my 13-year-old flat out stopped participating. He is a straight A student and said he did not feel motivated or challenged online. Also, I have a huge uptick in screen time with my 3 boys, lack of motivation, and depression. My 13-year-old is suffering the most and needs encouragement and reminders to shower even. This is a child who plays competitive baseball normally and loves school. My kids' mental health is the reason they need to go back to school. I am a clinical psychologist and tuned into my children as I am. I have seen a huge decline in joy, happiness, and social skills since school stopped. They miss their friends and teachers. They miss the routine and structure. I miss them being tired. They are bored at home. I want school back and sports. I met with our pediatrician last week who confirmed that the children she sees who get COVID are very, very mild. I think we can figure out a plan to distance and keep safe. Please consider my plea to reopen. Kathy Wolmanowski, school board, families, and community members. In the recent surveys taken by families and teachers, the option to return to school as normal was by far the option chosen by the highest percentage of individuals. Many people realize it is essential that school resumes as usual in August for the students' social, emotional, and academic well-being. If we absolutely must return some form of remote teaching, the district should begin with the hybrid model and go to full-time remote learning as a last resort. The implementation of remote learning should begin with high school students first, as they are the most independent. Elementary students should be the last group to go remote as they need more teacher support. Due to their ages, they legally cannot be left alone while parents go to work. While the majority of families and teachers want to return to the classroom, the surveys did show that some people would prefer a hybrid model and even fewer would prefer full-time remote learning. The district should consider matching up students with teachers who share the same learning preferences. Families could choose the option that they are most comfortable with on a first-come, first-filled basis, and they would have to commit to that option for the year. While many teachers worked extremely hard to provide educational excellence during the recent shutdown, some did not, and this sadly was evident from many of the comments made at the last board meeting. Unfortunately, there was a great disparity in the level of rigor and instruction provided to the students. Even with the best educators and the most involved families, remote learning still cannot cover as much material with as much rigor as in-class learning. It is our duty to provide the best possible education for all students, and remote learning, even at its best, cannot do that. If the district offers any form of remote learning, it must support the resources necessary to provide a quality education online. This would include parentheses, but not be limited to parentheses, Dreambox, Lexa, and AR. These programs are academically sound, research-based, and get results. For example, in my classroom at the beginning of the school year in Lexa, 41% of my students placed below grade level and 59 placed at beginning grade level. Parentheses, no one was above, in parentheses. By the end of the year, only 6% of my students were below grade level, 23% were at grade level, and 71% were above grade level. In Dreambox, my students completed almost 4,600 lessons and mastered an average of 21 standards per student, exclamation point. Dreambox, Lexa, and AR are established programs that need to be supported by the district during the uncertain time more than any other, exclamation point. Remote learning would also necessitate a platform that would allow teachers to instruct students online in a live forum. While Zoom was amazing for connecting with students, it was no great platform for instruction. Finally, there needs to be accountability for students and families to do work. If students do not attend online classes and do their assignments, they should not be given passing grades. They should be retained. That is the end of comments again. That's got to be the end, right?
It actually is not. Thank you, Dr. Vollmer has presented additional. I think it's imperative the board listen to all public comment before they enter into the discussion.
Chris Bossy. I have serious concerns about the reopening of schools, even more so as cases have spiked over the last few days, and our county is rolling back to more restrictions as we speak. My fear has only been exacerbated by the lack of communication and clarity from the district, which has been both surprising and disappointing. This includes survey results which do not include results of all the questions asked, which also sets off alarms that a certain narrative is being pushed that does not accurately show what the survey truly identified. Furthermore, the survey took place during a time in which our county was not having a resurgence of cases. A new survey is needed to capture better data since all polls are lagging indicators and only a snapshot in time, a time that is long past. As an extremely high-risk person with 2 autoimmune diseases and asthma, I do not believe my safety is being considered at all. Let me be clear. I miss my classroom. It's my second home. I've created an engaging environment that fosters close relationships and encourages learning. I miss my students. I am a passionate educator, and my students are what makes the world go round. I desperately wish school could be normal. I wish kids could work in groups, share their thoughts and ideas, and get hands-on in-person education with me. However, it's not about what I miss and wish. It's about keeping students and staff safe. It is not safe to return to the classroom yet. What kind of message do we send if we ignore safety just to get back to normal? Also from Chris Bossy. I want to address racially insensitive comments that were made at the previous board meeting by a member of the Board of Education. This member thanked security agents and police. Remarked on a protest in Chicago, over 300 people were shot, including a 3-year-old. Not one person was shot was a police officer. First, this is inaccurate. There were not 300 people shot anywhere, especially in Chicago, and I would like the member to publicly release the sources used for information. In bringing up Chicago, a common thing to do when denying police brutality is an issue because of a high crime rate in that city. This member is playing on racial tropes and stereotypes. Furthermore, this argument reverts to black-on-black crime as a diversion from the ongoing police brutality and the systemic racism within the police force at large. Secondly, it was very disheartening that these comments were not rebutted in the room. To my ears, the silence was deafening and spoke to a tacit agreement with the comments of the board member. I would like to give the original board member a chance to recant his statement and also give each member of the board an opportunity to answer whether or not they agree with the statements made by the board member. The voting public would be interested to know the answer. Julie Miller. Dear members of the board, as both a teacher and a parent of DSUSD students, I want to take a moment to address the reopening of our schools. We all know that we are living in unprecedented times, and this public health crisis has somewhat turned into a political divide. No matter the decisions you make today, you will have people upset with you. I do not envy the weight of the decision you must take, but the responsibility of protecting the health of our students, our staff, our teachers, and our local communities on your shoulders. As a parent, I know that the success of distance learning from March to June varied greatly between students. Some students thrived and had engaging, wonderful lessons, while others did not. Some parents ensured their students continue to engage, while other parents could not, either because of struggling to meet the basic needs of their family or because they saw it as optional. I think because of this mixed bag of experiences, many parents are reluctant to use the distance learning again. However, given them the opportunity, the support, and including accountability via attendance and feedback and time to plan, teachers and students can make distance learning successful. I have spent the last 3 weeks as an avid summer bridge teacher. In the 3 weeks, I have worked with a fantastic group of teachers, taking an in-person curriculum and making it engaging and successful online. We built virtual classrooms through a community building and relationship building and had a phenomenal student engagement rate. Today was our final day, and my class Zoom went 30 minutes over our scheduled time because several kids did not want to leave or have the class end. I say this not to draw attention to myself, but to share with a collaborative team clear student expectations and engaging activities. We can build a virtual classroom communities and make learning happen. As a parent and a teacher, I realize that distance learning is not the same as traditional learning and that our students and children are missing activities and experiences. However, living through a pandemic is not the norm. We cannot say that we are in unprecedented times, yet continue to do everything we have normally done. Would I rather be teaching my students in person? Absolutely. Would I rather my incoming first and fourth graders have a normal school year? Absolutely. But more importantly, I want to know that my students and children, colleagues, and friends are safe. Many parents claim that we should return as normal with no masks because of the children not victims of COVID-19. I would challenge these parents to say that our sixth grader at Glen, who buried her father a week ago, is she not a victim of COVID? Or to the average bridge kids who dropped last week because their entire family is ill, are they not victims? Children may not be susceptible as adults, but they can transmit COVID-19 to anyone they come in contact with, taking home to their parents and siblings by the end of the day, same as us. As you make plans that will affect the health and well-being of our entire community, I urge you to think of our health of our children, parents, teachers, staff, and community. And finally, from Lisa Davenport, when and how will the next survey for families be sent? 3,000 was not a representative number. Did the district use emails on file with each school site? Are we considering different models for different levels, elementary, middle, and high? What, if any, physical support will school sites be getting from district employees, teachers on special assignment, counseling, special education, assistant superintendents, realizing the enormity of the responsibility sites will need them out and about to help? How will our contracts with YMCA and Desert Recreation be affected if we go back using a hybrid model? Can these organizations be utilized for extra hours or different hours to help support our families and their child care needs? For example, if a cohort of children come to school from 8 to 11 and then need child care through ACES or YMCA from 11:30 to 3, or go to child care from 8 to 11:30 and then to school from 12 to 3. Are we still considering a hybrid model? If yes, then why has the task force only offered two options, virtual and traditional, to families? Can we give concrete examples of several different models within the hybrid model? Many different countries, states, cities, school districts have many different possibilities. In the next staff survey, can we have the frontline staff responses broken down by elementary, middle, and high school? Who is reporting out information from our district surveys to the local news? It was falsely reported that most parent families want to go back to traditional school in the fall, when in actuality, 57.6% wanted only if there are no restrictions placed on us from CDC or Riverside County Health. Finally, regardless of the model we choose, will the district counseling department and the district nurses get any extra or diverted funding for the expected support they will need? Thank you for your consideration and open minds. And that concludes comments.
All right, thank you very much. So just to recap, again, I want to thank Dr. Cook and the task force for setting up this conversation. It's a very critical conversation that we're going to have today regarding reentry into the fall. So again, to recap, what's been put forth are some thoughts around different options. The first being full distance learning for those that desire, if that best fits their situation. The second, traditional, with a preferred 5-day a week within public health guidelines, but if we can't meet the public health guideline requirements, then we would have to consider a hybrid model, just to frankly reduce the number of persons in a physical space to comply with the public health guidelines. So that's an offset of traditional. And then third, which is a most recent consideration, is to begin the school year in a distance learning mode and slowly move into bringing students back to a traditional setting. We would have to be mindful of what's in Assembly Bill 77 to that regard. I do want to emphasize that all of these models will require a lot of work and collaboration with our associations, so we appreciate that partnership moving forward. So with that said, a reminder to the public that tomorrow, 4:00 p.m. is the virtual Bailey and Coffee. There is an interactive survey instrument within. Depending on the conversation and the outcome today with the board, which may shape what we put forward in the public comment tomorrow, we will get immediate feedback from teachers, staff, and the community regarding the models. And that will hopefully influence work that goes forward, bringing you a final proposal July 9. Sound appropriate?
So, Anna Conover, are you still there? I know you are. Anna? She hooked up?
I'm here. I was muted. Can you come back to me?
Do you want me to come back to you?
Would you please?
Yes.
Thank you.
Wendy Jonathan?
Hi, I have a few questions. Now, we're talking about monitoring the students to make sure that they're attending school. How exactly are we going to monitor them to make sure that they're attending it? I see that, in your presentation, you talked about the amount of time it takes to complete a project or something will be going towards how much time they get credit for, but I think it's really important that they're also participating virtually. And as well as, how do we know, as far as the teachers are participating? I know it's not the usual person, that not all teachers were like that, but I will tell you there were some teachers that only had one contact with students during the entire time. I know that's an extreme, but are we doing some kind of accountability for the teachers? Will they, so that's one of my questions. And do you want me to stop after each one so someone can answer them and then I'll continue on?
Yes, if I may, Mrs. Johnson, this is Mr. Bailey. I'll defer to Dr. Clay May-Vollmer. A lot of the answers to that question lie within the new Assembly bill.
Yes,
Okay.
thank you. So in regards, Mrs. Jonathan, to your first question about monitoring attendance, the model that was put forth tonight regarding assignments turned in, that's a model that we currently use in our existing independent study program, and that is a model acceptable by the state. In addition to that, Assembly Bill 77 requires a few things. It requires that a log be kept, noting students that are engaged, as you mentioned, in a virtual environment. And in addition to that, it requires that the district write a tiered re-engagement plan that is used to help students re-engage once they've missed either 3 days or 60% of the virtual learning time in a 1-week span. And Mrs. Fisher and her team have already been diligently working on that plan and are close to finalizing it.
And so I'm assuming that there will be kind of a SARB kind of process that we're going to have for students if they literally don't have any contact and they're not doing any of their work, correct?
Yeah, we're still learning specifics from AB 77, but it does indicate that chronic absenteeism must be tracked and monitored and addressed. So I would imagine, yes, we would have a process.
I know we're talking about different models, and this is just question and answer, so I won't say any of my comments till we get to that point. That being said, we talk about the students coming back to school. What I understand you said that if we do some kind of hybrid program, there would be the cleaning done on Wednesday. Would that be sufficient, since we would be having students in the classroom for Monday and Tuesday, and we want to make sure that nobody's touching anybody else's desk? Would we be, how would we monitor something like that? As far as cleaning the classroom, would the teachers be then expected to be cleaning the classrooms on a daily basis?
I believe Mr. Aquino might be online. Mr. Aquino, would you care to respond?
missed that last part about the cleaning of the classrooms.
I just want to clarify if the students, they're going to be in the classroom, if we do a hybrid model, and I'm not even going into the traditional model because I think that it's a foregone conclusion that we can't physically do that. So if we do a hybrid model and we have half the students showing up on Monday and Tuesday, a day between that where there's a break where there's cleaning done. What about Monday and Tuesday, though? I would think that you'd want to have the classroom cleaned on a daily basis. Even if you did have it on Wednesday, how would the custodians be able to handle that load of work to disinfect all those classrooms?
So under the hybrid model, we would essentially have less students on campus. So custodians will be able to access more areas a little bit more efficiently because there won't be any students in the classroom. Now, our custodians are scheduled to be working every day, Monday through Friday, once school starts. So under that type of situation, I think we would be able to effectively clean the classrooms with a little bit more of an intensity.
You talked about, the students there, and I'm assuming that either their lunches will be packaged and brought to the classroom because they won't go to the lunch area, correct?
So that is something that we are considering. So we're exploring all those types of options. If we go to a brick and mortar / hybrid where students are being transported in, we are also looking at situations because, as Dr. Cook was mentioning earlier, we potentially our breakfast offerings for students would be impacted. So we're looking at other types of alternative solutions, providing for meals when students enter the campus. So a lot of things are being considered under those, depending on which model we end up selecting. And as far as the lunch goes, certainly we could do a prepackaged meal. Now, if we consider that instead of students going through a line, which we do also think we can accommodate that, the additional meal cost would go up pretty substantially for the prepackaged. So there's just a lot of things that we are considering, but either scenario that the board would like to select, we will make sure that we accommodate that, whether it's a prepackaged through the lunch line or a traditional meal service, through the cafeteria.
But they will be, my understanding is, I believe that the students will be expected to be eating in their classroom because we don't want them to be social distancing around other students while they're eating, correct?
That depends on a lot of different scenarios, depending on how we schedule and the way the principals set up the breaks. Now, that is something that can be considered with regard to bringing in meals into the classroom. The issue with that is we are still limited to the amount of custodians and the time that we have to clean the areas once the students are done eating. So it's certainly a little more effective for us to clean the area if it was focused to one location. If we had that spread throughout, the school site, that would make it a lot more difficult to accomplish keeping everybody, safe.
Right, and I'm concerned if we talk about them eating in the lunch area, then we have to keep the social distancing. The students will now no longer have their masks on their face. They couldn't be across from each other because that's not a 6-foot distance. So we're looking at some real logistics, and then having, I guess, our lunch ladies trying to monitor that and make sure that everyone's staying in their place within their own classroom, correct?
So the people who monitor that would be our school site monitors. Now,
Right.
logistically, that would be it would depend on the school site, because every school campus layout, some are more conducive to a 6-foot distancing. If, there was only one lunch period, I think more optimally, we could, we'll do what whatever we need to accommodate, we're going to get it done. But I think the most ideal situation for us would be a 2-hour window for lunch servings for students. So if we, however the scheduling works out with, each individual school site, optimally for us to achieve something like that, a 2-hour window would be more beneficial for the food services division. However, depending on the campus, that can look very differently from one school to the next. So can 6 feet be accomplished? Yes, but it also depends on the layout and the schedule.
Right, and I would assume then that they're only getting at the most 20-minute recess lunch, because we also have to account for them, a new group coming in, disinfecting everything, and then coming and letting the next group go in. So, quite honestly, it sounds kind of like a nightmare, but my next question, which is kind of a nightmare situation as well, is how are we going to monitor our students when they need to use the restroom? We all know, as a former educator, I know that you transfer so many diseases and colds from your hands. And I know we're going to be encouraging them to wash their hands and using disinfectant, but they'll be walking into the bathroom, opening up the bathroom stall door, going to the bathroom, leaving. How do we assure that those bathrooms are being cleaned on a regular basis, basically as students come and go? And how do we avoid them congregating in a bathroom where we have more than one in a bathroom?
Yeah, so that would be very difficult to try to monitor. Now, just to go back to, the amount of custodians we have, during the last recession, the district, due to some cost savings measures, looked at the custodians and reduced the custodial staff. And that was never, I guess, for lack of a better way to explain it, just brought back. So those ratios kind of were lost due to the last recession. So our custodians have been doing an absolute excellent job trying to maintain the school sites under, with their current capacity. Now, we are going to do things, and part of our planning is if we go back to, full brick and mortar or some kind of hybrid scenario where we're doing more signage. We'll put signage, at the school sites, but that will, those mitigating factors won't necessarily absolve, potential student from maybe not washing their hands when they leave the restroom. They aren't currently being, accommodated into the restroom and or chaperoned, if you will, and I don't see that being anything that we're considering. So there really is no way to monitor that, in my opinion, other than through training and education of the students.
Okay, and some, especially in elementary school, it's really hard to train 7-year-olds to say 8-year-olds, hey, by the way, let's be consistent, especially when, and I'm looking at Anna on the screen, who's an elementary school teacher. I remember my kids, I have to go to the bathroom and I have to go now, and they want to dash out because they're holding it in till the last minute. So I'm concerned about that. I also, you mentioned about buses. Obviously, I'm assuming on the buses, we would have one every other seat, I'm assuming, or groups of family members on every other seat, because we would need to do that social distancing on the bus. And do we have enough buses for the routes that we would need? Are we going to have to scatter even the starts of different, let's say, elementary, even if we have only the elementary school start in a hybrid model, are we going to have to stagger start times because we're going to be using so many buses to transport our group of kids that would be normally on the bus? Because I would assume it's going to take at least 3 bus rides to maybe accommodate the kids getting to bus, and that's with half the people coming. I know that they get pretty crowded, and after every bus ride, are the bus drivers, or are we going to have custodians? How are we going to do it where I'm assuming they'll be disinfected the moment the kids get off so we can get a new group in?
Yes, so, we've had meetings on the buses, about the buses and how we would handle that situation. Now, the difficulty with that is, and some of the examples of the public comments we're bringing up were the situation at DRA. Now, DRA buses during the normal school year, approximately 800 students. And so assuming, all 800 students and parents wanted to return back to school, obviously that would be very difficult to be. I think we have approximately 13 buses that take kids in and out of that school. So certainly if all kids came back to school, it would be almost impossible with current staffing to accommodate transportation without extending times, because we have to ensure 6 feet social distancing with the bus. There's going to be conversations about adding time potentially due to the unloading and offloading of students. If you look at the California Department of Health, there's considerations for how we are to assess students' well-being, whether they're coming on the bus. So I guess I went off on a little bit of a tangent there, but yeah, it would be something that we would have to explore and how we can accommodate that with current staffing. Now, our bus staff has done an excellent job. Both Jessica and Chuck, our managers over there, have been doing an excellent job with scheduling. So we do have times where we could allocate the staff where they're doing I think it's called garage time, where they're doing things like activities for the disinfecting of the buses. But assuming that we return back to school under the current guidelines, limiting to, or pretty much not having any field trips and things of that nature, because we can't control students going off campus and the activities that are happening off of our control. We could potentially see additional drivers to do regular routing, but it certainly wouldn't be enough to accommodate if we were to return 100% and everyone were to come back to school.
But there would be a need for some increase in staff, because I don't see, even if we cut, I see how crowded those buses get. So especially with the elementary school students, they're packed. So if you're literally only going to let them on every other seat, and I believe there's like 60 seats on a bus, am I correct?
So we could, depending on the year of the bus, can fit anywhere from approximately, I think it's 89 to about 93 students per bus. Now, depending on what the state comes back with, because we're seeking clarification on, proximity of students in a location, that is really going to dictate how we end up doing, or how we would potentially operate business. Now, we would do things to increase the efficiency of our routing, and that would be, putting siblings together on the bus. We would certainly keep the kindergartners in the front of the bus and start everybody from back to the front. That way people aren't crossing paths as much as possible. So things like that are things that we've been considering.
And you mentioned about buses and students getting on the buses. We're going to have to take the temperatures of the students when they come to school. I'm assuming we're going to take the temperature of all students when they walk onto the campus, or no?
So we are discussing that, and in the event that is likely that we move in that direction, we are already planning in the planning phases of that, a little bit deeper than just the beginning stages. I'd say we're in the middle of that. Now, the California Department of Public Health's recommendations is to check temperatures of students when they get onto, I think it's campus is what they say. And the CDE's recommendations were to check student temperatures when they get onto the bus. So because of those, that language, we have already been preparing for that, just to ease some of the fears with some of the questions that we've received from the community. But we are trying to seek some clarification on the use of the face coverings and the amount of students that we could potentially, have in a location.
Right, because if we do take their temperatures, then you have a logistic problem because first of all, then I guess the bus drivers are taking the students' temperatures. Because I wouldn't want a student getting on a bus, being sick, and now exposing everybody in that bus with COVID-19. So I would assume that we would be best off, as you said, taking their temperature when they got on the bus. Are we going to have enough temperature gauges? And I'm sure you've ordered them. And then if they try to get on the bus without a mask, are we then going to have masks sitting on the bus that we will make sure that every single student has a mask when they get on the bus as well? And then on top of that, piggybacking, how are we going to go about monitoring all the kids' temperatures that are walking on campus? Are we going to have somebody standing at a gate just taking temperatures as we go? What if someone does have a temperature? Again, I'm using primary, elementary school as an example, and the child wants to get on the bus and has a temperature and there's no parent there. What do we do about that kind of situation? We can't really drive away. I don't know what we have to do. So what are the precautionary measures we're going to be taking?
So we just had a meeting even just this morning with our transportation department, and that would be to involve that we would make sure that we had enough masks for any bus driver at every time, if in the event that a student were to get on the bus, that we would have a disposable mask for their use. That way, our plan would be to cover every kid that is routed to ride that route to have a face covering in the event that all kids, let's say all kids showed up at the bus stop with no mask. So that way we would ensure that they are putting on the mask prior to them entering the bus. Now, as far as the temperature screening, there is no, other than a active use of a thermometer, kind of like with the ones with the laser pointer type, would be something that would have to be used by the bus driver. The options for kind of an automatic screening for the bus, there are few and far between. So that wouldn't necessarily be an option. They do have thermal cameras. We do have cameras on the buses, but those cameras, they would capture everybody all in one shot. Who wouldn't do, individual as people got on the bus. We would have to develop, and we've already discussed this, protocols, because we have a note. We can't leave a child left behind at the bus stop, nor can, time is of the essence. So if a student, let's say, had an elevated temperature, we couldn't just leave the kid there. Sometimes the parents aren't there with their child. The child will walk to the bus stop on their own. So we would have to develop a protocol that would require an isolation area on the bus, similar to what we would do at a school site. And that would be to maintain an isolation room for a student if the student was exhibiting symptoms of COVID-19.
Okay, and with regards to, if somebody is sick, are we going to be increasing the number of nurses we have on campus? So are we going to have a nurse at every campus? And I know that's a huge expense, but how are we going to accommodate the fact that at any given time we could have students with coronavirus, and maybe we want a health personnel and taking care of that as opposed to office personnel.
So, I'm not going to speak on anything as far as the nurses go, because that's Laura's, Ms. Fisher's area, but I can speak to the idea of hiring, whether it be nurses, custodians, or anything. Now, the district, as most people maybe not be aware on the call, are going to be a net COLA zero. So what that means is every year we have cost pressures to the budget, like step and column, stirs and PERS. So we won't be receiving those normal increases. Now, our budget has a deficit, a structural deficit, even with the zero COLA from the state, not that negative 7.92%, which would have been devastating for us, to fund new and additional services. So at this point, if we were to add those kinds of services, we would have to explore other options in our budget to replace in order to fund those types of activities. Now, the CARES Act that came in and the legislation that is tied to the CARES Act, and we're getting an estimated, I think, anywhere between $25 to $30 million. Now that now has the direction for that originally was to mitigate COVID-19 and has been redirected to mitigate the learning loss due to COVID-19. So that restricts the types of activities that the board can consider, things like additional custodians, that kind of stuff.
And touching on that, when you talked about learning deficiencies that we might have had with some of the students that are behind, are we going to be able to offer any kind of tutoring for those students to get back on track that may have gotten behind because of the corona, because of the closures of the schools?
Mrs. Jonathan, this is Dr. Ballmer. Do you want me to answer that, Mr. Aquino?
No, I'm not on the instructional side, but certainly anything can be considered. The thing is looking at our resources and making sure that we're prioritizing the highest needs of the district. That's all.
And Mr. Aquino.
Well, and I totally understand that. I know that we're dealing with a problem as far as the state giving us our money, and that they're talking about deferrals, and it's not a good time at this time for school districts. But I just was clarifying to find out if we can if there's even the ability to help those students that got behind, and how you can answer that question.
Mrs. Jonathan, this is Mr. Bailey. We have an answer for that. I'll defer to Dr. Kelly Mae Vollmer.
Yes, Mrs. Jonathan, a couple of approaches to that concern that we all share. As Dr. Cook mentioned during her presentation, we of course have diagnostic assessments that we'll be administering. In addition to that, all of our models have built into, with the exception of full-blown traditional, but the hybrid and the virtual, looking at built-in times during the day to attend to our students that need more attention, whether that be our English language learners, our students with special needs, or even our students that have just fallen considerably behind. So opportunity built into the day for that. In addition to that, we have ongoing funding that we receive for things like tutoring and support, and those funds will still be available, and we will find a way, whether it be one-on-one or in a virtual environment, to provide those services to students.
And my final question, and I'm trying to include everybody, all the cabinet. I have a brother who's got, now I was going to say COVID-19, he doesn't have COVID-19, although my cousin did. My brother has COPD, so he's a high risk, and he lives here in Palm Desert, and I have to keep distance, and I try to see him, but we see each other from afar where I go over, and I kind of hang out by my car, and he's inside his house. We have staff that have family like I have, that they're concerned about their family, their children, that are high risk. What if a staff member does not want to return to school? what opportunities are we giving that staff member, whether they're classified or certificated? What are opportunities are we giving these people so they don't have to worry about risking their health or their loved one's health?
Mrs. Fisher, are you available?
Or I think this is Dr.
Dr.
Salazar.
Salazar?
I think I can
Okay,
respond
thank you.
to that, perhaps.
Yeah.
And Laura can add in if she wants.
No, go ahead.
Our employees have been fortunate so far because of the school closure. They were able to do their work remotely in the certificated realm, and in the classified side, we did make allowances for people, as you described, to work remotely, and if they couldn't, they were allowed to stay home and not report to work. All of our employees have the coverage, insurance coverage extra available to them through the federal HR 6201 Families First Coronavirus Response Act. That goes through December 31st. And I've heard there's a possibility, we don't know, of course, what the federal government's going to do, but that they may be extending that. Then finally, that would be one of the negotiable topics, the issue of leaves that we would have to be discussing with our union partners when we know what instructional model or models we're going to be starting with in August. Then we're going to have to sit down at the table with them and collaborate on the possibilities. And as Mr. Bailey told you, and these are ideas because they're not finalized yet. They have to be negotiated and agreed upon. Any effects to the bargaining agreements that arise out of these different instructional models. But, you know, there's just ideas at this point. There's a possibility that we would be in favor of the idea that with medical verification, the individuals who are compromised could be the ones who do distance learning. But I think it's really unlikely, Mrs. Jonathan, that that's going to just match up evenly, you know, that there's going to be that many families and the exact same number of teachers or employees. So then we really have to discuss and come to some agreement on how that would be decided. I've also heard from teachers that worry about the inequity of that also. You know, it's not an easy solvable problem, but it's something we know that we would have to work on. And we would try to do the best to accommodate those individuals as long as it's feasible.
Yeah. And I'm going to go ahead, Laura.
No, and I was going to finish up. I know you were talking to Jordan about the nurses, and we have an unbelievable team of very busy nurses. And so with our district the size we have 9 RNs and 7 LVNs and 6 health techs, which to some people sounds like a lot, but if you look at all the different medical procedures throughout the district, they are working every minute at every school site. And then we had 3 retire. And so I think we've hired 2 out of the 3 so far, which has been great. And Susan Cadell is our new lead nurse, and she's been working closely with the California School Nursing Organization to do exactly what you're talking about, Ms. Jonathan, in regards to looking at school site and how we would have that isolation room. And Jordan was just right on when he was talking about as far as the bus. Yeah, the best thing to do is to make sure the child has a mask on and isolate them as far away as we can on the bus till we can get them to school and contact parents or whatever we need to do. So those protocols are in place and are working to be in place so that we have those available rooms at the school sites, because that's going to be important whether it's a student or staff member if they become ill at school.
Okay. And now that I've talked a lot, and I still have some questions, but I'm going to let my colleagues ask the questions so I don't take away all their questions that they want to ask.
Mr. Tomac, do you have any questions? No, sir. All right, then I guess I'll go. It looks like we're the closest to scenario B, and from what I'm hearing, in that when we come back, we're going to have a highly modified and restricted schedule. So I'll look at the data that we have, and it looks like it's divided up a third, approximately. And so if we have restrictive public health guidelines, it looks like 8.5% of our students like the Horizon model, and 24 want to go on full distance learning. So we're going to lose a third of our students that even want to participate on campus if we still have a COVID issue happening. And then the next two things, those are just my own observations, so somebody jump in if I'm wrong. And then we have 34% that are in, whether there's COVID or not. And so do we have the capacity to teach a third of our students, assuming that they're equally distributed K through 12? Do we have staff that we can get on campus to teach a third of our students in a traditional full-time instruction in a traditional school setting?
Dr. Salazar, would you care to try an answer to that based on what you know currently?
It'd be hard for me to know exactly. We have that survey that, we did put out, but I think things have also changed. I've heard from teachers that when they answered that survey, things are different right now. So it's hard for me to assess how many teachers want to come back. I've just seen lots of and heard comments, and some of it anecdotal, that there are teachers that want to come back. There are teachers that wouldn't mind the hybrid, and there's teachers that would be most comfortable in the virtual setting.
Okay.
I don't know for sure.
But it looks like we got about less than 2 weeks to figure out how we're going to open this thing up, and we need to start limiting our choices. And so is it possible for us as a school district to get a third of our kids in online distance learning, a third of our kids in a hybrid situation, and a third of our kids in a full-time situation? Because if we can't do all three of those things simultaneously, we got to chop it down into two choices.
So this is Dr. Ballmer. So looking at the three models and discussing them with the task force, one of the things when you're looking at the school as an entirety, so transportation, nutrition, health services, all of that, and then distancing in a classroom and looking at our staff that we have available, we believe, as the task force discussed, that it would be, you could run a traditional model with a virtual model, or you could run a hybrid model with a virtual model, but it would be incredibly difficult to run all three models at the same time. So yes, to your question, probably need to consider two.
Okay, so if we're going to need, if we only really have a choice of two, and the choices seem to be, we're either going to go traditional full-time and online distance learning, those two are compatible, and hybrid is compatible. So, and then you look at the numbers, because we're going a third, we have to make the assumption that if we're going to go to a hybrid model, that all the students that wanted to go traditional full-time would rather go hybrid than traditional. So that ends up being 2/3 of our students. But if 2/3 of our students are going, that means we're really only teaching 1/3 at a time. So when we talk about the busing issue, we're not going to be busing 100% of our students. We're either going to be busing a third if we go traditional, and then the other 66% opt they don't want to go full, or we're going to go 2/3, which still ends up only being a third because it's hybrid. So we really aren't going to have a transportation issue, because we're only going to ever be transporting a third of the students at each day. And so when we start to micromanage things, we're never going to be in a hybrid where we're doing 100% of the students right now to open, okay? And so some of the issues I don't see as being a catastrophe. I believe it would be, for the grab and go, I think that's the way to go, because I think that's easiest for our food services, that makes it easier to prepare everything in the kitchen and keep them safe. And then I think we should see I think it's a shame that we cut off 1,500 to 2,000 seniors of their experience at the end of their senior year. And I know we're going to have to make a decision on, is it more important to have the elementary school open or the high school open? And so my preference is, I think if we're going to have a third of our students want to be in, and we don't have teachers to accommodate that we start from the top down instead of the bottom up. I think a person that was a junior that missed the end of their junior year can't be the last person into full-time school because we're going to offer that to the smaller children or the younger children. I just think it's too important for them to go off to college and not be disgruntled, disillusioned, and potentially depressed. Where I think we, and I'm not a psychologist, although I may play one on TV. But I just think we'll have the chance to touch those elementary kids later, and we'll have the ability to offer them assistance if they are depressed if we don't get to them for 2 years. But we're losing seniors potentially this year that this is it. They're not going to college. As much as we want to have college and career-ready kids, we're going to have kids that graduate in the class of 2021, and it's going to be their last educational experience, and I don't want it to be done from the sidelines. So if there's a possibility and we have to start bottom down or top down, I think we should go with the older kids. There's a lot of discussion about sports, and I don't think we even have a dog in that fight, because I think CIF is going to tell us if they're going to have it or not. And if CIF isn't going to have athletics, then we're not going to have athletics. So until we get and they're supposed to make a decision, aren't they, coming up? July what?
Get you that date?
I've seen it.
Yeah.
I've seen it.
I don't have it on the top of my head yet.
So if CIF pulls the plug, which I believe they're going to pull the plug on fall sports, that's also going to be a non-issue that we're not going to have to work around. We're not going to need to worry about buses for that, because I don't think they're going to let us do it. Then when we get to our teachers, there's been a talk of a great disparity of the effort put in, and I believe whether we go to a hybrid, which I think will only be using 1/3 of our capacity for school, because we'll be having 2/3 of our students come half at a time, which is 1/3, that we are going to have classrooms available for every teacher that doesn't want to teach in the classroom and wants to be educating that instructional distance learning, to provide them with a classroom with the technology. I think it's easier to provide the teachers a classroom and technology in the classroom than it is going to be to set them up to work remotely. And I think that should be one of our goals, is having all of our employees present. And I just think it's important for everybody to be accountable. We have a contract right now. It says they work so many hours a day. And my thinking on that is, if our janitors clean your room once and you're the only person that goes in it, don't allow anybody in to talk to you, and nobody else is going to contaminate it, and you will have all the technology and all the information and all your resources at your fingertips. And if your room gets contaminated, it's because you let somebody in to talk to you. So I think people have to be accountable. Also, when we were talking, and I heard like a kid forgets his mask for the bus stop. Now, I know that's going to happen. I was a school teacher, and kids forgot their pencils every day. But I never had a kid show up without shoes. And I think, honestly, that when parents know to get on the bus, you have to have a mask, and they want them to go to school, they'll have a mask. Like we're way overthinking these things. And it's not going to be a whole busload of kids missing their mask. It may be 1 or 2. And then when we dial it in and say, no, you got to bring it, you got to bring it, you got to bring it, it's going to be, you wear shoes and socks every day, you wear pants every day, you wear a shirt every day. I think eventually they're going to get the hang of it. Everybody in here's got a mask on, and I think everybody knows I forgot mine once, and I'm trying not to forget it again. So, over time, we will become conditioned to have the things we need to perform. And I think I work in an office, and nobody's providing us masks, and everybody wears a mask every day. It's to the point that we've gotten that far, and I know I was lax at the beginning, but I'm trying to stay on top of it. So I think we need to make the decision if we're going to go hybrid or full, and then it looks like no matter what we do, 32.5% of the people want to do Horizon or distance learning, and they're not coming back anyway. So we need to get them in the queue, lined up, get them their information, their resources, their Chromebooks, and sign them up and the teachers that want to do the interactive, I don't see why we should be waiting to figure out what they want. I mean, the line should form, and they should be like, look, I have concerns. I want to be one of the people doing interactive. How are you going to help me? I don't think we need to wait till June or July 9th, when the data says 32.5% of our people want to do it, and in reading the comments from the teachers, a lot of them don't want to come. We should be setting them up for success, and we shouldn't be waiting around 9 days. So I guess I don't have any questions. I've made all my statements.
Don, you keep on mentioning a hybrid or a traditional, and I'm going to be honest because I didn't say my point of view, but quite honestly, the direction that we currently have the trend going in Riverside County, I probably would say I want us to initially do distant learning and then transition over.
Okay,
I may
but
be the only
I'm
board
not
member that
saying-
feels that way.
I'm not going to make
That's-
anybody do it.
Excuse me, I'm finishing my comments. The only reason I mention this is because you've mentioned that, and I think that we haven't decided what model we're looking at. And I think that we also have to be cognizant that things are changing, and we don't know what things are going to even look like in a week from now. A month from now. So I'm concerned about even doing a hybrid at this point in August, but that's me. And as I said, I will acquiesce if my other colleagues feel otherwise, but I don't want to assume that that's how it's a given that we're going to go straight into a hybrid.
Well, I think we better start assuming something because we got to have a plan on July 9th. And so we may be changing things in 30 days, but we need to put a plan in effect on July 9th, and we need to tell our staff, and we need to tell our families, and we need to tell our students, this is the option. Hybrid, yes or no? We're not making the decision today. Full class, yes or no? But what I'm not advocating that we make anybody attend Monday through Friday, traditional 8 to 2:30. And I'm not saying we're going to make anybody do the hybrid every other day. I'm saying if we have the opportunity, we should give that as an option because we've already done 100% online distance learning, and we clearly have some families, we have some staff that thinks that doesn't work. And so if we can improve on it, we should do it. That's whether it's hybrid or all in, it's people want it. We have staff that say they want to do it. And I think we should be making, if we could do all three, which I hear we can't, if we have to, if we can't do all three, then we got to pick two. And if we have to pick two, we got to pick the two that satisfy the most amount of people. So that's what I'm saying. I didn't infer that we were going to make people do the hybrid, and I hope I didn't infer that we would make people do the all-in. I'm saying if we have the staff and we have it supported, it should be an option because people clearly seem to want it.
I believe we have a date for the CIF.
Oh,
We do. I have an amazing assistant that just texted me that
July 9th?
July 20th is
Oh.
the date CIF will make their decision.
okay, well, tell them that they need to make their recommendation by July 9th and get back to us. Okay, so those are my comments. Anna, are you ready, or do you want to go to Linda?
No, I'm ready. I've been listening to all of the comments that you guys have made. And so I'm thinking as a teacher, I'm thinking I'm in the classroom. How am I going to keep these kids safe? And I teach elementary. So I'm thinking of how many times do they need to go to the restroom? I'm in a portable with no water. I know many of our teachers are, especially the ones that are at sites that are being, that have construction going on, are in portables with no water. And I know that there's talks of, the little portable washing stations being brought in or purchased, or some of the disinfectant. My concern, Wendy went through a lot of the concerns about the disinfecting and things like that. So that's been brought up. As far as this, in one of the high school, middle school models, the schedules, I saw social emotional challenges. I know that, bumping off of what you said, Mr. Griffith, the high school kids, I know that it was a tough year for our seniors. I had 2 nieces that graduated this year. It was a tough year, not just for them, but for the families. You know, they felt they missed out on a lot, and they did. So for the high school level, how are we going to deal with some of the social emotional challenges? For example, health concerns, race relation concern, given the political climate, the wearing of the masks. Are we going to bring in some more support staff for that? So that's one concern. My other concern is right now reopening is kind of it's kind of going backwards. I think they closed all the bars in Riverside County now, and the number of COVID cases is growing exponentially. It looks like on a daily basis, it's just, you know, getting out of control. Our hospitals are almost at capacity. So it seems like we're going backwards. I don't think traditional right now would be possible, but I would like to see, and quoting one of the teachers that emailed me this weekend, he says, we really didn't do distance learning. He mentioned that we did crisis learning. It was a crisis. We weren't prepared for it. But now that we have time to prepare, is it possible just to start out with some distance learning, and as our numbers decline, start going back into the classroom? And we can start with the older kids. I do understand that a lot of the concerns for the parents are kinder, teaching those foundational skills, the basic foundational skills. It's going to be hard to do virtually. I taught kinder for 7 years, and it would be hard to do. But these are special times. So I'm thinking, you know, I don't know what would be the best model, but I don't think traditional would be it at this time. I don't think we could safely offer traditional. But that's where I'm at right now. I'm looking at all the numbers that are being told daily. You know, we listen to the news every day, and I'm thinking more along the line of maybe starting out distance learning, but slowly, as the numbers get better, maybe open it up to the hybrid. I'm also thinking of childhood disease comes on quickly. I've had students that come in, they're fine in the morning. By lunchtime, they're vomiting or their stomach hurts. So, and COVID-like symptoms, but we would never know if it was or wasn't. So these are all issues and concerns that we kind of have to keep in mind. And right now, the nursing, I don't think we have a nurse in every school every day. I think they share schools. Am I correct?
Yes, they do. But each
Yeah,
nurse has about 3 schools. Each RN has about 3 schools. The LVNs and health techs are spread throughout the district, but each RN has about three schools, 3 to 4.
So each RN has 3 schools, and what's an average number of students at each school?
Well, it depends on whether it's a high school, elementary school, or middle school. So, I mean, looking to high school has over 2,000, and we have to staff it depending on the pre-COVID. It depended upon the needs of, medical procedures, different diabetics, different needs at the school sites. Now we're looking at that on top of this. Now we don't know how many parents will feel comfortable sending their kids that have any kind of specialized medical procedures. So it could be, just like we're trying to figure out numbers now, it could be that those health personnel would be available to do some of the other things, depending on who we're providing education for virtually, and when we get to a brick and mortar, who's actually going to be in the schools.
Because school is, I mean, it's less than 6 weeks away?
Yes.
Beginning. That's a very short window of time to get all these scenarios ironed out.
Yes.
Maybe we need time to actually start out and, see how we start out online virtually. And as we can implement things safely, rather than just kind of go, okay, let's just either or, either going in every day, or you're going in twice a week, or you're totally on virtual. Because things have changed from the date that survey was implemented, that window, it's changed quite a bit. So maybe some of those parents that were 57% with restrictions, they might be changing their mind. Because the last board meeting, a lot of the comments were send my child to school, send my child to school. This one, a lot of comments are don't start traditional school. So I mean, it's changed quite a bit in that small amount of time. So I know that there's a survey going out tomorrow with the Bailey's Coffee. Maybe that'll give us a clearer picture of what people are thinking with these numbers that are currently, because it's ever changing.
Yeah.
It's ever changing. And, we don't know from one day to the next. And that's the uncertainty that I have.
Mrs.
And
Conover.
that's all I have.
Mrs. Conover, this is Mr. Bailey. To your remarks and for the pleasure of the board, again, referring back to the most recent legislation received last week, Assembly Bill 77, there is some forgiveness of not attending in person up to about September 1 within that bill. But the Assembly bill makes it really clear, which is difficult for persons to attend an in-person instruction to the extent possible. But again, there is some buffer there to September 1, specifically, as I recall, the legislation. Now, that's notwithstanding, as you pointed out, the ever-changing statistics and potential changes in public health orders. So should there be a public health order that declares it's not safe to be in school for whatever reason, that would obviously override and put us all back in distance learning regardless.
Okay, which would make sense for us to have some type of a distance learning in place so that we're not going back into the crisis mode again. So,
Well, Ms. Conover, I can tell you that during our ESY in summer school, it's really giving us a great opportunity to see kind of our distance learning 2.0, because it really was, and I know our engagement, particularly with our preschool through 7th grade ESY, has been about 78–80%. And the teachers, and I know Dr. Kelly Mae Vollmer did the same thing with summer school. There was a schedule and there's grades and attendance. So it's been kind of that nice intermediate opportunity for us to see what it really, like you were talking about a teacher saying it was, what they say, it was crisis learning. I mean, it was turned around in a day. I mean, we had to literally, figure it out on a dime. And now it's kind of giving us the opportunity to really see and have a more robust program. So that's given us a good opportunity during summertime too.
thank you.
Mm-hmm.
Those are my comments. Thank you.
Thank you. Linda Porras.
Okay, hi everybody. First of all, I just want to say thank you to Dr. Cook and to the task force for really putting this together, and it's really hard. I can't even imagine how difficult it's been. It's difficult for us to do what we're doing, considering everything. And yeah, Wendy, you pretty much already asked all my questions, so. But I do have one thing I want to ask about, considering the hybrid, when you were talking about having the kids come Monday, Tuesday, off Wednesday, and then Thursday, Friday. And my one concern would be about what about the Monday holidays, because there's several Monday holidays. So that group, the Monday, Tuesday kids, would miss, that one day. So is there any kind of consideration for that?
This is Dr. Kelly Mae Vollmer, Mrs. Porras. There was actually great consideration to that concern. And so as you might have seen on several of the schedules, that day for student intervention and collaboration was placed on a Monday, specifically considering that concern. So we absolutely know that is something we have to look at.
Okay. Um, okay, and then, just like everybody was saying about how you kind of had to go by the seat of your pants when this first happened to do the virtual distance learning. And I know it's good to know that there's been a learning curve, with having to implement it over summer school. So that's good news. And I was just, thinking that we should have our teachers, just have more training in what needs to happen for virtual learning, and to help with the social and emotional strategies to support staff and our students. And I think that my feeling is, due to the way the coronavirus is spiking right now, that there's no way we could have our kids be back in school right now. That it would have to start out as the virtual model, and at the beginning, and see how it goes. And we really have to watch how the COVID is spiking, and when it starts having a downward spiral, and that hasn't happened. I mean, it did temporarily, but now it's back up. So that's pretty much the thing that is ruling everything. But I think that we do have to have something in place, and we do have to have it in place for our kids and for the number one, safety for our kids and our teachers and our staff. That's like number one. That should be our number one goal. And of course, we want everybody to go back to normal, but I think this is like, of course, it's already been said, it's a new normal. This isn't, we're going to really go back, I think, to 100% normal. But anyway, that's my feeling, is I believe that we need to really focus on doing the best possible way we can do virtual learning for our teachers and our kids. And as the stats come in for the virus, and if they start going down, then we start implementing the hybrid, where we have some kids in school, at different times. I have a question, though. Dawn mentioned something about possibly having the teachers in the classroom, and then the kids are virtually, like in the classroom, but virtually. But there's the teachers actually are in their classroom, where they have all of their supplies and their boards and everything that they can work with, which I think would be easier for them. I'm not a teacher, but that just sounds like it would be easier for them to do that. And I don't know if that's even a possibility. Would that be something that would be considered, that the teachers would actually be in the classroom, and then they're isolated in their classroom? They wouldn't have any contact with anybody else. If they do, it would be very limited.
So this is Dr. Kelly Mae Vollmer. To respond to your question and even some of your other comments, so yes, that is a possibility. And yes, we already are looking at solutions for a hybrid model and a full-blown virtual model from an equipment standpoint. So we're already working on that. And it certainly is an option that teachers work from their classrooms, like you mentioned. I wanted to also mention that in regards to the social emotional learning, Mrs. Fisher's team, in addition to the amazing website that they created for resources during the closure and throughout the summer, they are currently creating lessons and things for teachers to use, a toolkit, if you will, once we come back. And then in addition to that, we have been working behind the scenes, preparing for these models, creating toolkits. One of the teachers mentioned earlier in their statements that it would be great to have step-by-step directions, for example. We're working on that. We're working on a toolkit of engagement strategies. We're working on a toolkit for checking for understanding. So all that's being prepared for our teachers right now as we're looking at the different models, so that we will be ready, depending on which model that we choose. So I just wanted to respond to that.
Okay, then I have another question. As far as the Wi-Fi capability for all of our students, do all of our students have access to free Wi-Fi so that they can have the virtual consideration for them at home?
So we do have the MiFi hotspots that any student can check out if they need one. Yes.
Okay. Okay. Then my other question is this: say a parent has 4 kids, like I have 4 kids. They're all adults now, but you have 4 children in elementary, junior high, and high school, and everything's going to be done virtually. And so they're going to need 4 different computers, or, you know, as far as being in school at a certain time. Do we actually help provide that for the families?
Absolutely.
Like before?
Yes. We have
Okay.
2nd through 12th grade, we have Chromebooks for every student. They've been using those to and from home for a couple of years. We did when we closed schools in March, we're using tablets for our kinder and first grade students, TK through first grade students. We had an issue with some of our tablets in that we couldn't push out our filter to them because of the type of model that they were. We since then have replaced those, and so once we resume the school year, regardless of what environment we're in, every student, TK through 12, will have a device that they can use at home or at school.
Okay. Okay.
And,
All right,
and Ms.
well, that-
Morris, Ms. Morris, I know, and I apologize for not responding to Ms. Conover either, as far as the social emotional, there is, and Dr. May Vollmer mentioned it. There is not only that, but there's a universal screener that our mental health therapists are developing right now for all students, preschool through 12th grade. So that we're addressing that as whether they're entering a brick and mortar or coming back virtually, because we all know, as Ms. Conover was mentioning, with everything going on in the country and the world right now, it's a lot on anyone's shoulder, particularly a child. And so we have a lot of screeners and then, trying to look at to ensure that we have staff across the district that can provide the support that's going to be needed for the kids and the families and the staff. So it's yeah.
Yeah. Well, the other thing too is is there something in place? And I can't remember. I think you've told me this before, but is there something in place in case the child is like being abused, or there's any kind of abuse going on in the home? Is there something that is in place for them to get help?
Well, and we've talked about, I think before, CPS, I mean, we heard from them quickly after the closures because they were noticing the downturn of calls, because the children usually, when they're, having issues at home, it's when they're at school and they confide in someone so that's why, we sent out things as far as teachers being aware, and I know through our counselors that they were letting the counselors be aware that something didn't seem right, when they were meeting even virtually with the kids. So, there were calls, there were CPS calls during the closure, there were, suicide risks that we addressed during the closure too. It's just being able to stay in touch. It's a little harder virtually, but that's what we're going to be working and training on.
Okay. All right. Thank you. Thank you so much.
Okay, I believe that's everybody. So, Mr. Bailey, do you have anything, concluding thoughts?
Concluding thoughts, is it possible to do some kind of a wrap-up in the general direction you would like us to move?
Well, okay,
I'm hearing, just for clarification, I'm hearing the possibility of delaying physical report back to school, and everyone to be in a distance mode until such time. And again, I would mention a trigger date potentially of September 1 per legislation, that we would consider bringing back people into a traditional environment. Also hearing that we're looking at 2 distinct possibilities as far as models.
What I would like to know when we come back on July 9th is, do we have the capability to do, we're going to do distance learning. That's a given, just with the things that a third of our parents want. And so if we're going to do distance learning and a minimum of a third of the students are going to be involved in that, what are our options for either the hybrid or the traditional? My preference would be to have a third of our students be allowed to do their traditional experience and let the other 2/3 do the online, and then the schools will be open, and we can transition those back when everything's better. So, Mr. Tomac, what's your preference?
Well, like I said, it's, you always, the old Drucker thing that we always talk about. What is our business? Who's our customer? What does our customer consider value? Our customers seem to want, they're our parents, they want our kids back in school. So my option is to the full traditional model as quickly as possible with a hybrid option that's available to the parents, and that would pretty much sum up the majority of the parents and what they're looking for here. That'd be my personal opinion.
Mrs. Conover, what's your input on that, direction-wise?
Certainly, we have to have some type of an online presence, an online model, for the simple reason that at any time the governor can institute it or have us close down again, or we can have, you know, a ton of COVID cases in one school and we have to close that school down. So we need to be prepared for virtual learning. That's a given. I don't think we would be prepared for a traditional at the moment, but certainly moving on to a type of hybrid. I know, Mr. Bailey, you said September 1st. Maybe see how we start out at the beginning and then try to slowly move, because yes, a third of our parents said that they wanted, you know, the different, it was equally a third, a third, a third. However, that was at that time. And so we don't know what it is now. But I would like to see it start out that way. Distance learning and then slowly move into the physical school.
Mrs. Jonathan.
Actually, this is a study session, so legally we're not allowed to make a decision or
We're not making a decision, we're giving input on direction.
I would even argue that that's making a decision or saying that the direction we want to go. That can only be made during a regular meeting, and I really think we're kind of crossing the line here. And so I'm not going to share how I feel, because I don't think that during a study session, it's only to hear information, ask questions, and get clarification, and not to make any decisions on that. And that's legally we're bound by that because of the Brown Act. So I'm not going to say anything. I think that we should not be having this discussion right now.
Okay. Mrs. Porras, do you want to have input?
Well, I agree with Wendy, because I know that we are having a discussion. We're talking about all the different forms and the different models. And so I don't know, I'm not going to make a decision right now. I think that we're still gathering information and still leaving it open to another survey. So that's where I'm at right now.
Okay, so I would just say that I don't believe we're legally restricted to giving direction as long as we're not voting, which I think what the Brown Act says, we can't vote on anything. So my direction still stands, and I'll stand behind that. Mr. Tomac? Ms. Conover? Do you want to stay with your direction, or do you want to withdraw it?
I will stay with it.
All righty. So, Mr. Bailey, you want to conclude now?
Yes, and again, I'm not asking for a decision. There's a lot of work that has to be done, and I do appreciate the board's Q&A and discussion on these topics today. We will take this back for consideration. Dr. Cook, do you feel like you have all the necessary components you need? And again, as stated previously, tomorrow we will be gathering public input, staff input regarding these models. Again, fact-finding. And that survey tomorrow will actually stay open 48 hours following the live event that begins at 4 o'clock. So there's additional input coming that will help and guide the task force in their final recommendation to the board, which will be as soon as July 9th, and that's where the board will make a decision.
Okay, on that, wish everybody a safe and sane 4th of July, and good luck until we meet again on July 9th. This study session is closed.